ಶ್ರೀ ದೂದ್ ಪಾಪೇಶ್ವರ್ ಕಂಪನಿಯು ಸುಮಾರು 152 ವರ್ಷಗಳಿಂದ ಆಯುರ್ವೇದ ಔಷಧೋತ್ಪಾದನೆಯಲ್ಲಿ ತೊಡಗಿಕೊಂಡಿದ್ದು ಉತ್ತಮ ಶಾಸ್ತ್ರೋಕ್ತ ಅಧಿಕೃತವಾಗಿ ಪ್ರಮಾಣಿಸಲಾಗಿದೆ ಮತ್ತು ಕಾಲಕ್ಕೆ ತಕ್ಕಂತೆಯೇ ಹೊಸ ಹೊಸ ಔಷಧಿಗಳನ್ನು ವೈದ್ಯರ ಸಮ್ಮುಖದಲ್ಲಿ ಬಿಡುಗಡೆ ಮಾಡುತ್ತಲಿದೆ. ಇವತ್ತಿನ ಈ ವಿಷಯವಾಗಿ ಸಂಬಂಧಿಸಿದಂತೆ ಕೆಲವೊಂದು ಔಷಧಿಗಳನ್ನು ನಮ್ಮ ಜೀವನ ಶೈಲಿಗೆ ಪೂರಕವಾಗಿ ಕಾರ್ಯನಿರ್ವಹಿಸುವ ಕೆಲಸಗಳನ್ನು ಮಾಡುತ್ತಿದ್ದು ಅವುಗಳಲ್ಲಿ ಕೆಲವೊಂದನ್ನು ಇಲ್ಲಿ ಹೇಳಲು ಇಚ್ಛಿಸುತ್ತೇನೆ. ಮಧುಮೇಹ ಕುಸುಮಾಕ ರಸ ಇನ್ ದಿ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಫ್ ಮಧುಮೇಹ ಆ್ಯಂಡ್ ರಿಲೇಟೆಡ್ ಉಪದ್ರವ. ಮೇಹಾನಮ್ಮನೆ ಶಂಕಿಸುವ ಕಾಂತಿಶ್ರೀ ಬಲವರ್ಧನಂ ಮೇಹರೋ ರಸ ಶ್ರೇಷ್ಠ ಪ್ರಮೇಯ ಹಿತಕಾರಕ. ಈಸ್ ಟ್ಯಾಬ್ಲೆಟ್ ಕಂಟೆಂಟ್ ವಸಂತ ಕುಸುಮಾಕ ರಸ ಸ್ವರ್ಣಯುಕ್ತ ಪ್ರೀಮಿಯಂ ಕ್ವಾಲಿಟಿ. ಮಾಮೇಜಿಕ ಘನ ಆಮಲಕಿ ಗುಡುಚಿ ಶೋಧಿತ ಶಿಲಾಜಿತ ಹರಿದ್ರ ಯಶದ್ ಭಸ್ಮ ಆ್ಯಂಡ್ ಪ್ರೊಸೆಸ್ಡ್ ಇನ್ ಬಿಲೋಪತ್ರ ಸ್ವಾರಸ್ ಆ್ಯಂಡ್ ಆಸನಕ್ವಾತ. ಮೇನ್ಲಿ ಎಫೆಕ್ಟಿವ್ ಇನ್ ಮಧುಮೇಹಜನ್ಯ ನೇತ್ರವಿಕಾರ, ನಾನ್ ಹೀಲಿಂಗ್ ವೂಂಡ್ಸ್, ದೌರ್ಬಲ್ಯ ಆ್ಯಂಡ್ ಇಂದ್ರಿಯ ಶೈಥಿಲ್ಯ. ಅದರ ಜೊತೆಗೆ ಕಾಕಲ ರಕ್ಷಕ ಯೋಗ ಡಾಕ್ಟರ್ ಇದೊಂದು ನ್ಯಾಚುರಲ್ ಥೈರಾಯ್ಡ್ ಸ್ಟಿಮ್ಯುಲೇಟರ್. ಈಸ್ ಟ್ಯಾಬ್ಲೆಟ್ ಕಂಟೆಂಟ್ ಅಮೃತ ವಿಶೇಷ ಶೋಧಿತ ಗುಗ್ಗುಳ 200 mg, ಕಾಂಚನಾರ್ 100 mg, ಅಶ್ವಗಂಧ ಗುಡುಚಿ ಚಿತ್ರಕ ಆ್ಯಂಡ್ ಕಟುಕ 50 mg ಈಚ್. ನಾರ್ಮಲೈಸಿಂಗ್ ಥೈರಾಯ್ಡ್ ಇಂಡೈಸಿಸ್ ಕಾಕಲ್ ಗ್ರಂಥಿ ಕ್ರಿಯೆ ಅಲ್ಪತ ಆಲ್ಸೋ ಬೆನಿಫಿಷಿಯಲ್ ಇನ್ ದ ರಿಡ್ಯೂಸಿಂಗ್ ಎಲಿವೇಟೆಡ್ TSS ಲೆವೆಲ್, ಸಪೋರ್ಟಿಂಗ್ ವೆಯ್ಟ್ ಲಾಸ್, ಇಂಪ್ರೂವಿಂಗ್ ಲಿಪಿಡ್ ಮೆಟಬಾಲಿಸಮ್ ಆಸ್ ವೆಲ್ as reducing oxidative stress. Then ರುದ್ರೋಗ ಚಿಂತಾಮಣಿ ರಸ್ ಡಾಕ್ಟರ್ ಪ್ರೊಟೆಕ್ಟ್ಸ್ ಹ್ಯಾಂಡ್ಸ್ ಇನ್ ಪ್ರೊಲಾಂಗ್ಸ್ ಲೈಫ್. ರುತ್ಸೂಲ ಶ್ವಾಸಕಾಸಗ್ನಂ ಬಲ್ಯಂ ವೃದ್ಧಂ ರಸಾಯನಂ ಮರ್ಮರಕ್ಷಾಂ ಚ ಕೃತ್ವ ಯತ್ ರುದ್ರೋಗಾನ್ ನಿಖಿಲಾಂಚಯತ್. ಇದರಲ್ಲಿ ಈ ಟ್ಯಾಬ್ಲೆಟ್ ಕಂಟೆಂಟ್ ಬೃಹತ್ವಾದ ಚಿಂತಾಮಣಿ ರಸ್ ಇದೆ, ಸ್ವರ್ಣಯುಕ್ತದ್ದು ಪ್ರೀಮಿಯಂ ಕ್ವಾಲಿಟಿ. ಪೂರ್ಣಚಂದ್ರೋದಯ ಮಕರಧ್ವಜ ಅಕೀಕ್ ಪುಷ್ಟಿ ಅರ್ಜುನ ಜಟ ಮಾಂಸಿ ಮಂಜಿಷ್ಟ ಅಭ್ರಕ್ ಭಸ್ಮ ಆ್ಯಂಡ್ ಭಾವನ ಬಂಧು ದಶಮೂಲ ಕ್ವಾತ ಡಾಕ್ಟರ್. ರುದ್ರೋಗ ಚಿಂತಾಮಣಿ ರಸ ಮೇನ್ಲಿ ಇಂಡಿಕೇಟೆಡ್ ಇನ್ ರುದ್ರೋಗ ರುದ್ರವ ಆಯಸೇನ ಶ್ವಾಸ ರುತ್ಸೂಲ ರುದ್ದೌರ್ಬಲ್ಯ ಆ್ಯಸ್ ವೆಲ್ ಎಸ್ ಧಮನಿ ಪ್ರತಿಶಾಯ ಅದೆರೋಸ್ಕ್ಲೆರೋಸಿಸ್ ಅಲ್ಲಿ ಕೂಡ ಕೊಡ್ಬೋದು. ಡೋಸೇಜ್ ಬಂದು 1 ಟ್ಯಾಬ್ಲೆಟ್ BD ಡೋಸ್ ಅಲಾಂಗ್ ವಿತ್ ದ ದಶಮೂಲ ಅರಿಷ್ಟ ಅರ್ಜುನ ಅರಿಷ್ಟ ಆರ್ ಆಸ್ ಪರ್ ದ ಕಂಡೀಷನ್ ಆಫ್ ದ ಡಿಸೀಸ್. ಈ ನ್ಯೂರಾಲಜಿಕಲ್ ಮಹಾಕಲ್ಯಾಣವಟಿ ಚೈವ ಸ್ಮೃತಿ ಸಾಗರ ರಸಸ್ತದ ಮೇಧಾಂ ರಕ್ಷತಿ ವಿಶೇಷಣ ವೃದ್ಧೇಶು ಚ ಪ್ರಶಂಸತ. ಇದರಲ್ಲಿ ಈ ಟ್ಯಾಬ್ಲೆಟ್ ಕಂಟೆಂಟ್ ಮಹಾಕಲ್ಯಾಣವಟಿ ಸ್ವರ್ಣಯುಕ್ತ 10 mg, ಸ್ಮೃತಿ ಸಾಗರ ರಸ 100 mg, ರಜತ ಭಸ್ಮ ಅಭ್ರಕ್ ಭಸ್ಮ ಶಂಖಪುಷ್ಪಿ ಮಂಡೂಕ್ಪರ್ಣಿ ಎಷ್ಟಿಮದು ಗುಡುಚಿ ಆಸ್ ವೆಲ್ ಆಸ್ ಅಶ್ವಗಂಧ ಆ್ಯಂಡ್ ಹರಿದ್ರ ಕಾಂಬಿನೇಷನ್. ಮೇಧಸಾಗರ ರಸ ಮೇನ್ಲಿ ಎಫೆಕ್ಟಿವ್ ಇನ್ ಸ್ಮೃತಿ ಬುದ್ಧಿ ಭ್ರಂಶ ಅಸೋಸಿಯೇಟೆಡ್ ವಿತ್ ಜರ ಆ್ಯಂಡ್ ಮದತ್ಯಾಯ ಯಾಸ್ ಅ ಮೇಧ ರಸಾಯನ ಇನ್ ಸಪೋರ್ಟಿವ್ ಹೆಲ್ದಿ ಬ್ರೈನ್ ಫಂಕ್ಷನ್ಸ್. ಇದರ ಜೊತೆಗೆ ನ್ಯೂರಲಾಜಿಕಲ್ ಡಿಸಾರ್ಡರ್ಸಲ್ಲಿ ಇನ್ನೊಂದು ನಮ್ಮ ಪ್ರಾಡಕ್ಟ್ ರಸರಾಜೇಶ್ವರ ರಸ ಟೈಮ್ ಟೆಸ್ಟೆಡ್ ರಸಾಯನ ಫಾರ್ ವೇರಿಯಸ್ ಟೈಪ್ಸ್ ಆಫ್ ವಾತವ್ಯಾಧಿ ಇನ್ ದ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಫ್ ಜೀರ್ಣ ವಾತವ್ಯಾಧಿ. ಮನ್ಯಶೂಲಂ ಕಟಿಶೂಲಂ ಅನ್ಯನ್ ವಾತಾಗದಾನ್ ಹರೇತ್ ಪಕ್ಷಗಾದಾದಿ ರೋಗೇಶು ಬಲ್ಯವೃಶ್ಯೋ ರಸಾಯನ. ಇದರಲ್ಲಿ ಈ ಟ್ಯಾಬ್ಲೆಟ್ ಕಂಟೆಂಟ್ ರಸರಾಜ ರಸ ಸ್ವರ್ಣಯುಕ್ತ 10 mg, ಶೋಧಿತ ವಿಷಮಷ್ಟಿ 100 mg, ಅಶ್ವಗಂಧ 100 mg ಆ್ಯಂಡ್ ರಸಸಿಂಧೂರ 40 mg, ದಶಮೂಲ ವಿಶೇಷ ಶೋಧಿತ ಗುಗಳು 30 mg, ಭಾವನಾ ದ್ರವ್ಯ ಬಂದು ಅರ್ಜುನ ಪತ್ರ ಕ್ವಾತ, ಕಾಕಮಾಚಿ ಕ್ವಾತ ಆ್ಯಂಡ್ ಬಲ ಕ್ವಾತ ಡಾಕ್ಟರ್. ರಸರಾಜೇಶ್ವರ ರಸ ಮೇನ್ಲಿ ಇಂಡಿಕೇಟೆಡ್ ಅರ್ಧಿತ ಹನುಸ್ತಂಭ ಮನ್ಯಸ್ತಂಭ ಮನ್ಯಶೂಲ ಕಟಿಶೂಲ ಶಿರೋಕಂಪ ರಿಜಿಡಿಟಿ ಇನ್ ಪಾರ್ಕಿನ್ಸನ್ಸ್ ಡಿಸೀಸ್ ಪಕ್ಷಘಾತ ಗೃದ್ರಸಿ ಆ್ಯಂಡ್ ಸಂಧಿಗತವಾತ. ಫೈನಲ್ ಆಗಿ ಇನ್ನೊಂದು ಪ್ರಾಡಕ್ಟ್ ಇಂಟ್ರೊಡ್ಯೂಸಿಂಗ್ ಇದು ಹೊಸ ಪ್ರಾಡಕ್ಟ್ ಡಾಕ್ಟ್ರೆ ಇನ್ ನಿದ್ರಾನಾಶ್ರಯ ಆಸ್ ವೆಲ್ ಆಸ್ ಇನ್ಸೋಮ್ನಿಯಾ ಅಸೋಸಿಯೇಟೆಡ್ ವಿತ್ ಸ್ಟ್ರೆಸ್ ಆ್ಯಂಡ್ ಎಂಗ್ಸೈಟಿ. ಪ್ರಚಿತ್ತನಂ ಟ್ಯಾಬ್ಲೆಟ್ ರೆಸ್ಟ್ಫುಲ್ ಸ್ಲೀಪ್ ರಿಫ್ರೆಶ್ಡ್ ಮಾರ್ನಿಂಗ್ಸ್. ಪ್ರಚಿತ್ತನಂ ಮಹದ್ಯೋಗ ಪ್ರಸನ್ನ ಚಿತ್ತಕಾರಕಂ ಮಾಂಸಾದಿಕ್ವಾತ ಶಂಕವ್ವ ST ದಿವ್ಯಾಮೃತಾಯುತಂ ಬ್ರಾಹ್ಮಿ ವಚಾತ್ತಗರಶ್ಚ ಕ್ಷೀರೇಣ ಮಹಿಷಿ ಸಹ ನಿಶಾಕಾಲೆ ಪ್ರಯುಕ್ತಂ ಏಕಂ ಭಾವಟೇಕಾದ್ವಯಂ ಸಮಾಶ್ವಸ್ಯ ಶಿರೋಪಿಚುಂ ಯೋಜ್ಯಂ ವೈದ್ಯ ನಿರೀಕ್ಷಣೆ ನಿದ್ರಾಜನಕಯುಕ್ತಂ ವಿಶೇಷಾತ್ ಭೀತಚೇತಸಾಂ. ಇದರಲ್ಲಿ ಈ ಟ್ಯಾಬ್ಲೆಟ್ ಕಂಟೆಂಟ್ ಜಟಮಾಂಸಿ ಅಶ್ವಗಂಧ ತಗರ 600 mg, ಬ್ರಾಹ್ಮಿ 250 mg, ಪಾರಸೀಕವನಿ 50 mg, ವಚ 25 mg, ಭಾವನಾ ದ್ರವ್ಯ ಬಂದು ಮಂಡೂಕಪರ್ಣಿ ST ಗುಡುಚಿ ಆ್ಯಂಡ್ ಶಂಖಪುಷ್ಪಿ. ಮೇನ್ಲಿ ಎಫೆಕ್ಟಿವ್ ಇನ್ ನಿದ್ರಾನಾಶ ಇನ್ಸೋಮ್ನಿಯಾ ಅಸೋಸಿಯೇಟೆಡ್ ವಿತ್ ಸ್ಟ್ರೆಸ್ ಆ್ಯಂಡ್ ಎಂಗ್ಸೈಟಿ. ಡೋಸೇಜ್ ಬಂದು 1 ಟ್ಯಾಬ್ಲೆಟ್ at 2 tablet at the night or as per the condition of the disease. Thank you very much, doctor. Thank you very much once again to all our ಎಲ್ಲ ವೈದ್ಯರಿಗೆ. ಜೈ ಭಾರತ, ಜೈ ಕರ್ನಾಟಕ.
Thank you, sir. I request dear delegates, those who have finished lunch are requested to return and assemble in the hall as the scientific session will continue now. Dear delegates, please occupy your seats. Dear delegates near selfie point, please occupy your seats. The scientific session is about to resume. If you have any queries regarding the topics covered, please write them in the question box. Our panel will be happy to answer them during the discussion. Dear delegates, near selfie point, please occupy your seats. I repeat, dear delegates near selfie point, please occupy your seat. And those who have finished lunch, kindly assemble in the hall. Now,
College, Kuttapadi, Udupi. Presently, Sir is working as an associate professor in Department of Panchakarma in Kaher Sri B.M. Kankanodi Ayurveda Mahavidyalaya, Belagavi. He has published various articles in national and international journals. He has guided more than 12 PG scholars. Sir is also in charge of various fellowship courses in cancer and therapist courses. He is also working for various projects in the institutes, and he is also research person for various seminars. Sir has been awarded with the Best Consultant Award in the 2019 from KLE Ayurveda Hospital, and he has been awarded 2 times with the Best Paper Presentation in World Ayurveda Congress. Sir is member of Board of Studies and Faculty of Ayurveda. He is also member secretary of Institutional Research Committee, and he is also member secretary of Institutional COVID Task Force Health Consultant. Sir is also working for RGHS External Examiner for the various UG and PG exams. He is also working for RGHS as an external evaluator for PhD thesis. Sir, we welcome you wholeheartedly on behalf of AFI and all the delegates. Welcome, sir.
Hello, hello. Yes, yes. Good afternoon, everyone. Thank you for the beautiful introduction. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. Today, with my presentation, if you feel something is very good and insightful, it's because of my teachers, what you are getting. If you feel something is wrong and not scientifically, any mistakes, it's because of me. I failed to understand my teacher and sorry for that. With this, I'll start my session, and talking in the afternoon session, it's a great job to make you keep two works. One is make you understand and you people keep awake. I think second one I do better. First one, it is left to you how you take me. There was a request from the AFI. Dr. Balreddy sir called me that, sir, we need a talk. Then he has expects that we want only prescriptions because most of the practitioners are coming. Yes, sir, I'll try to best to justify myself that what you need. I tried myself, but little bit theory, because every time, every prescription may not work. It may work in 10 patients, 11th patient you may fail. So some amount of theory I may tell, but I try to give with every single case-based information. Okay? Yes. It's a my great institute which has given me a platform to come up with such outcomes. Okay? Clinical practice in neurological disorders in day to day. See, most of the time we are looking into most of these contents in coming slides, because everybody interested in the English word, so I put all thing in why I want to going to tell. Coming to the neurological disorders, Ayurveda people will have a fear that someone will do better than me so that I have to refer. Don't worry. You will also get a knowledge, because very minimum is left in doing neurology in modern medicine. What you do, that cannot done by a neuromedicine. Very rare and beautiful 4 or 5 finger counting disorders they can do, except surgical interventions. As a medical management I'm talking. Okay? Sir, most of the things are tumors, seizures, disorders, and cerebrospinal accidents, neurological infections, and disorders of the developmental disorders, and degenerative disorders, and the headache and facial pains. Very minimum I am taking out of this. And before going to any investigation, because Balreddy sir told that try to make them go for an investigation, understand, and utilization of the technology, today's technology. So you will come across this pathologies. You will come across this pathology. These are the basic need when you understand the disease. Minimum word meaning you should know that what has happened to that patient. This I'll teach. This also told in Ayurveda, that I don't want to teach that. These are the neuritis. This is an inflammation, neuralgia, neuroplasia, neurogenic, be nerve or a nerve system, neuropathy. Because small word change, there is slight pathology change. Okay? That's what I'm telling. You tell no why I put these all words. Ayurveda is little bit confusing. You see here one alphabet change, one disease changes. Nothing to worry like that. Ayurveda also telling the same thing, but only we are failed to understand that. Coming to the neuropathy, sir has stressed me that try to give more insights on neuropathy. So I have taken first into a neuropathy. There are different classifications, because anybody you want manage the things, it will be on the depending upon the cause what you are looking for. Why the patient came with this disease to me. So if you address that, that one Nidana Parivarjana will help you in most of the cases. Okay? Etiological, maybe first is a great diabetic component, and nutritional index induced, toxic, and hereditary. Why I put this? Every single component you will have one example. Okay? Autoimmune, infectious, and paraneoplastic. Say some are non-responding with us also, with them also. majorly in the patient will improve with only with Ayurveda is more. Coming to the type of fiber involvement, this you should know. What I tell is, we fail to understand this, whether it is motor induced deficit neuropathies or sensory induced neuropathies, which will recover very fast. If you know this, that's why you need to do a test called neuroconduction study, which will guide you a very beautiful ride for your outcome. First day only you tell that I may improve, but my improvement will be 20%. The patient will not have a question, he'll go ahead with the therapy. We came 100%, improvement is 10%, then there is a problem. Which case will improve, which case will not improve, that is because Ayurveda has also told so asadhya vyadis. We should know that. That's why Charaka tells that there will be Indriya Upatapa Janya Vyadis, Indriya Abhigata Janya Vyadis. Indriya Upatapa is nothing but a reversible pathology which you can repair. Upatapam. Indriya Abhigata is, it is damaged. It's an anatomical damage. It cannot be repaired at the level of tissue. But subjectively, I have an example. A patient improved 100% with the abnormal NCV. Okay? Then autonomic. Autonomic also you should know. Because where to red flag sign for not to practice. Even if you refer to a neurosurgeon, nothing will going to happen. But your born duty that there may be a chance of 1% improvement, it is that being in a doctor duty that I should refer that patient to a particular person. This is also very important. Axonal neuropathy, mixed neuropathy and demyelinated neuropathy. What exactly we are treating? Because in this also, some are improvement, some are not going to improve. If you know this, then very easy for you to take a counseling on a particular patient and have your medications. And mononeuropathies, that is example is one is carpal tunnel syndrome, because it needs a lot of surgical intervention. Mononeuropathy multiplex, the vasculitis and diabetes. Once again, see there is another classification the same as diabetes as came into the down. Polyneuropathy, then vitamin B12 deficiency. Most of the people are doing investigation that vitamin B12, vitamin B12. Exactly what exactly happened it is. If a patient after testing, you should seen that vitamin B12 is low, a disease is not started 1 month back, 2 months back, 1 year back. It has started minimum 4 years back. Because God has created such a physiology inside so that this whole vitamins will recycle by our physiology. Once it is getting deficit means the leakage or loss is something from the somewhere in the gut. We do treat this under the sometime Pandu Samprapti. See, every time only Neurobion, that such things don't work. Because you have to treat the root. Treat the root. That's why recently I am doing one observational study of 5,000 people, Pandu Lakshana with prevalence of HB. You know that having more HB is a disease nowadays. You tell that I am having 15, 16. No, it is because of your problem with the atmospheric. See, old cars, you check it out. Cars are without oxygenated concentrators. Now all cars are coming with oxygen concentrator. If you are traveling continuously in an airtight, air-conditioned car for a long distance to every month, 20 days, you will have a neuropathy and neurological deficit damage. Recently, a case from Nimans dropped out, I am treating. Because since last 25 years, he is traveling in a good car, he is a contractor, now he is not able to walk. I think all possible investigation done, everything is normal. So, having HB9 at village, no symptom of anemia is 100% not Pandu. 16 HB in metropolitan cities with all Pandu Lakshana, that is what is Pandu is. In all metropolitan cities, because of oxygen derangement, body making more immature RBCs unknowingly because of the hypoxia. That will mimic, wrongly predict that you are having a high HB. Nicotine toxicity, caffeine toxicity. You will, because when you analyze the blood, these chemicals will influence the titer. That's why there is a wrong. So, this is very important. And can be replaced with orally or not. Oral supplementations. If you eat 7 rupees, 12 rupees tablet every day morning, next day morning you will put it into the toilet because it is not in active form in the capsule form. But yes, I do tell that don't eat, don't give because it's a pharma industry mafia. I can't tell anything more about it. Because one strip you will get 7 strips free. To invent this molecule, they have spent $400 billion. So they have to get the money from the people. So injectable may be working, but in injectable there will be anaphylactic shocks or more than other than any drug. The vitamins will have more reactions. Sometime it should be treated. Okay. So food supplementation based active form of vitamin B12 supplementation is the best therapy. What I feel is okay. The symptom oriented sensory, there is numbness, tingling sensation impaired. So most of the time it will be inducing suptata lakshanas. What? So Ayurveda correlate this one to kafaja dusti. So don't let time same medicine to the same patient. I am having pain dominant, different medicine. At least sick differentiation you do. Sir, I am having pins and needles, different medicine. Sir, only numbness. I cannot feel my floor with my chappal. While walking, my slipper is slip off. Yes, it's a motor component. That time the treatment should be different. Okay? See, all this little bit basic understanding how the AIDP works, what exactly spikes you can see in your nerve conduction study, NCV study, how it is giving. Because this spikes will be because demyelinating acute phase demyelination is the best treated by Ayurveda better than anyone. Otherwise, contemporary, go for MRI. If you believe that there is acute, go for MRI. For MRI, if it is non-sclerotic, no pathological lesion, only demyelination, Ayurveda will relieve within 5 to 10 days. This demyelinations. Okay. See there. Why I put this little bit, people think that I am not reading. See, they have every edition there is a different approach because still they are also in trial and error method. This slide message is, even they are in the trial mode. Ayurveda is not in trial mode. Our science has written everything documentation. Suptata, Kafaja Dusti, Vedana Pradhana, yes, Vataja Dusti. Both are mixed, yes. There is a difference either. What is there in 16th edition is not added. So many diseases that they are adding by day. Okay? Diabetic neuropathy. This is two outcomes. In my 12-year practice, what I seen, it will be in the starting phase of diabetes is a more prevalence of the symptom. In the fag end of the diabetic, this disease will be very problematic. Starting phase, pre-diabetic state or freshly diagnosed diabetes, it is easy to treat. There is zero finding of NCVs. NCV will be normal. Only patient will have paresthesia, numbness, tingling sensation, burning soul, burning eyes, burning hands, burning whole body. Why exactly it happens? Why this burning will happen? Because most of the time this patient will be type 2 diabetes. 90% patients are not in need of any medicine. It's an improper utilization of insulin. So suddenly you are having 10,000 rupees in your pocket. One day I take money, then I left it only 10 rupees. Body will cry for that. Same thing will happen because humans can survive without insulin, every organ except brain and nerves. For brain and nerve, they don't want insulin. Only other organs all need insulin. Brain, that's why if the sugar drops down, you will have a headache. If sugar increase also, there is a headache. Directly blood can be utilized by the brain or nerves. Something impairment in this, it will make improper signal to the nerve and this leading to the burning soul. Okay? Yes. Coming to the understanding of stroke. Neuropathy, I will come the cases later. Stroke, this is also day to day. Most of the people in the name of Ayurveda, practicing wrong medication practice, but purely Ayurveda preparations are going to help in rehabilitation of the stroke. Not only old residual hemiplegia, fresh cases also you can handle. There is no problem. Only thing that advanced life support need makes the difference. If the advanced life support is there, let them stabilize in the 3 to 4 days. After the stabilization, take in your hand, you can deal. Otherwise, you are having a good setup, go ahead. There is no problem. Okay? I am not put every edition book information. See there. You read. See, this is the understanding. Very difficult. Lakin syndrome and bacillary artery syndrome, medial medullary syndrome. They are also telling, if you read the previous edition, this approach is not there. Since last 4 edition different. Suddenly from the 20th edition, they changed their approach. Because even they are not in a position to understand what will happen when there is a stroke happens. Okay? All are, every one blood vessel, they are telling one name of the syndrome. So that was my concern. But Charaka written Pakshagata Lakshana standardly, Shushita written some Pakshagata. What they have written, the outcome of the stroke phenomena, what has happened. Got my point? Outcome of the stroke phenomena, what has happened. But these people, priorly they are working because their management, they want to thrombectomy, they want to dethrombolize the thrombus because their approach is different. On their research, they work like that. Sir, what exactly you want to teach? It's nothing but Ayurveda is like this. Sir. It's the best and simplest way of telling Ayurveda is this. It's a dosha vaishamya. What you have to do is dosha samyata. Sir, ye dosha vaishamya samya. Madam, it is all individualized dosha vaishamya. There is no standard protocol cannot be prepared. That's why I'll give a best beautiful example for dosha vaishamya. Like everybody likes tea. Understood? But a person from Kerala, a person from South Canara, a person from Belgaum, and person from North India are different in taste. That is what is dosha vaishamya. Because samadosha cannot be found generalized. A person water in the tea. North Indian people like more of milk in the tea. Belgaum or here people maybe like more of sugar in the tea. South Canara people will be more of tea powder in the tea, they like more. So all are their likings. If a Kerala person came to North India, he will tell that there is a Jalakshaya Lakshana. For him, water content is reduced. The same North India person went to Kerala, there is a Kshirakshaya Lakshana. Milk should be added. The same person, Belgaum person went to Kendra, Sharkarakshaya Lakshana. Means this you have to understand. Everybody has level of understanding of dosha samyata. That has to be treated. That's why Chaya has been neglected in Ayurveda. Without dosha, no vyadhi is manifesting. It's understood by the dosha only, at least basic dosha to be have. Then bala of the patient. Every patient will respond same? No. Same disease in bala may respond different. In vruddha may different. It may not improve only. That I'm giving you an example. This is the Samanya Chikitsa is not needed. Then coming to Pakshagata, that is already management. What we did on the basis, I gave a references. Stroke phenomena. What exactly happened? If you understand this, if blood circulation to the brain is blocked, blood circulation is brain blocked, 100% blocked, how much time you are having? Hardly 3 minutes. 3 minutes. If it is 100% blocked, no one can save the patient. It is called decapitalization. If it is a focal, some part of the brain is there, nothing will happen. See there, a patient 120 minutes, nothing has happened. You have a time. That time only you have to utilize. That's why Shushruta or Charaka tells it's the apatantrakavat chikitsa. You have to treat like a vega chikitsa, apatantraka chikitsa, sadhya pramodana chikitsa. That is not vatavedi chikitsa that time. It will be an emergency management. Okay, that part you are not want to do, leave it. This settlement takes place. Afterwards, our job is there. Some people are doing this job also. If you understand this, is a very most important. This will change with respect to every organ. Only brain. What happened? Hello. Now it's okay. Especially with the brain, I have put here because most of the time stroke phenomena can be understood. You are having 3 minutes or more than 120. It may go days, 15 days. That's why doctor tell 48 minutes, 48 hours, kuch nahi bol sakta hu. This is what will happen. Either it's in a complete stroke or incomplete stroke or resolution starts. Okay. What Ayurveda tells, Kevalam Nirupastambam Madhav. It should be make it Kevalavata, then you treat. Before Nirupastamba, some workup is different. First day only massage karne shuru karte hain. That's what the wrong thing. Don't see such practices are not in Ayurveda. Then sometimes it should be like avarana. In stroke only, there are some demyelination disorders, not in a vascular insult. That time it should be in the name of Urustamba because pathology is somewhere, presentation is somewhere. Urustam, this avarana and all, I'll come to the avarana a little bit. Tasyam na snehanam kaire. I am not written. I am not came to teach you shloka here. It's written, don't do snehana there. Every patient, vata prakopa you feel and you start giving the prescription. No. Nowhere it is told. Don't give only at the first phase. Then all the vyadis what, sir? It's samsargaja vyadis, avaranajanya vyadis, gatavatajanya. Every disease in Ayurveda manifests like this. In which boat you are running, your ride is very important. Then what is avarana? This is how it is like this. It will be sometimes symptom and going back. This is what, because I made it very simple to understand what exactly avarana is. So many Ayurveda doctors will give one reason in avarana, they'll escape their answer. No, I am not like that. Till date, I try to understand what avarana is. Sir, this avarana will happen by chance? Love at first. No, from the first day of Nidana, the avarana will decide. Not that in between someone you get it and you got a love with them and you not marry. No. It will be from the first day. I'll give a beautiful example. Sir, what exactly happened? It will do Ushna with Ushna, no. Means I'll give you one food example. Yes. There is shloka you read in Sarvada Sarvabhavanam Samanyam Ruddhikarakam. My muscle is not less, I'll eat non-veg, my muscle will grow. Sarvada Sarvabhavanam. Rasa hetu viseshascha. If you eat opposite, it will reduce. Why? It should take avarana, no? That's why Charaka is having this difference. I'll give you an example. From the first day how it will happen. I'll give you a best example. Avarana how happens. Like in Rakta Pitta, it has been explained that one is Nidana by Ushna and there will be Shita. Person who is eating Ushna and Ruksha. One pathology. Snigdha and Ushna. Ushna is common both the side. Both the side Ushna is common. One person is eating Ruksha, one other person is eating Ruksha. Snigdha Ruksha makes the Samprapti different. How? One person eating Katak roti Ruksha, Karadpudi, chili powder. So he will suffer with Adoga Rakta Pitta only. This is what Ayurveda is. Another person eating Ushna Snigdha, butter chicken. He'll have Urdhvaga Rakta Pitta only. This is what Ayurveda is telling. For other people, bleeding disorder is common. Either it bleed from this end or that end. But Ayurveda people know. If he is eating Katak roti and chili powder, Adoga Rakta Pittam, you have to treat Pitta more. If it is Snigdha, like butter chicken, you have to treat Kapha there. Pippallasava works here. Because you have to treat Kapha. Ishat Ushna, Pippalli Rakta Pitta Hara. Adoga Vasakara Savaigyu. Sita, it will take care of Adoga Rakta Pitta. This is what the change. That's what I want to tell. Don't think that now most of the people are mixing together and the proprietary medicine are coming. It's a curse for the Ayurvedic future, because people will forget what was the real classical drug. Coming generation will never remember. Some Ayurveda old people, they have read and they remembered. This is what the difference. Sir, another avarna, sir, Anyonya avarna. See, it is Anyonya avarna is only Vata is doing Vata. What, sir, what you are telling Vata? It's a direction mediated disease. Udano, Urdhvam, it should be like this. I am talking because my Udana Vata is working. If my speech loss has happened, it is due to the avarna of my Udana. That you should understand. The direction mediation has blocked. What exactly this avarna example? Snigdha Ruksha. See there. They are the beautiful example of Vada. Inside there will be Snigdha, outside there will be Ruksha. This is what avarna is. Inside there will be Snigdha, outside there will be Ruksha. To make it Snigdha is more component, to Ruksha to be treated first. But because of your Sneha Guna, inside Snigdha should not disturb. Such therapies to be done. French fries, same pathology. Inside Snigdha, outside Ruksha. Because Ayurveda drugs are working on the guna, not on the allopathic contemporary pharmacology. Ayurveda is, I am giving Shita Dravya, yes. I am giving Ushna Dravya, yes. I am giving Tikta Rasa, yes. I am giving Katu Rasa, yes. This is our pharmacodynamics. Because Shastra is written on that principle. Learn this basic so that you will be a master in practice. And patient will teach you this. Sir, after drinking this medicine, this has happened. Don't take it in negative way. Take it in positive way. Yes, I have went wrong somewhere. Then how this fighting will take place, sir, inside? How this fighting will take place? Ushna Sikta. Sometimes Shita is having very less Nidana. Ushna is having more Nidana. So never become avarana. It will be samsarga vyadi. Chalo, mere saath aa jao. Samsarga vyadi karenge hum. The fighting between the equal strength, Nidana is so equal, then only two independent samprapti develop inside the body. That's why if you treat this, he'll lead. If you treat this, he'll lead. You have to treat the both. Then only you'll win the race. Okay? This is the example. So little bit pharmacology of Ayurveda pharmacology. Ushna, Ruksha, Shita, Snigdha. So this will go avarna, but this never go avarna. They never go avarna. Ushna, Snigdha, Ushna, Shita will go avarna. Because I am eating that Shita Nidana also, Ushna Nidana also. In both ways, there is samprapti is increasing inside the body. That's what I already given this example of Rakta Pitta. There is Snigdham, Ushnam, Ruksham, Rakta Pitta example. This is a spectrum of the diseases. Who will suffer with Jwara? Who will suffer with Rakta Pitta? Who will suffer with Vata Rakta? Okay? See there, 80% Rakta, 20% Vata. It will be Rakta Pitta, Jwara. 50 Rakta, 50 Vata, Vata Rakta. 30 Rakta and 70 is the Rakta Pitta. Rakta Pitta is not avarna Janivadi. Already they made a friendship with Vata means it will do Adhoga Rakta Pitta. 30% Kapha means it will make Urdhva Rakta Pitta. But 50-50 Vata Raktam. That's why patient will come to sir. कभी कभी चलता हूँ ना सर तब पाँव दर्द होता है 2 मिनट बैठता हूँ ना आराम होता है It's avaranam. Hit the proper because nidana walking. Complaint either it may be neurological or it may be vascular claudication. Treat accordingly. I'm walking, getting pain, taking rest, doing good. It's an avarana only. See there, avaraka decreased and increased symptoms. How exactly it happens? Sometimes it will be coming, showing and going, showing and going. Even CVD is also sometimes chest pain, don't neglect. Showing and going, showing, one day, dumb. See, that's why, see there, modern people, they did a treadmill, whether this is due to this or what. If you are run for 8 minutes in Bruce protocol, yeah, okay, tested, heart is tested, okay, go. What we are doing, where treadmill test is told in Ayurveda? Yes, it is told in Ayurveda. It's an innovative procedure practice of Ayurveda only. It has told in Staula Chikitsa. Staula, it has been told that Krichra Vyavaina. Krichra Vyavaina. Read the articles on during intercourse, a person will reach his highest heart rate. That is target heart rate. If his purpose is normal intercourse, his test will come negative only. Don't worry about it. Read the articles. Person will reach his highest, that is age minus 14. 200 minus your age is your target heart rate. That much you will reach. That's why Charaka written, Kruchra Vyavainam, Shurashulabam, post-coitus headache is there, evaluate. He may be having block in the brain. See, it's an exploration. I am not telling that milk test is totally different and Ayurveda is telling where to correlate. Okay? This little bit vata only. In these principles I want to treat. This little bit karma, if you know, then you will understand the stroke. Okay? So I will not go into deep because still more there are a lot of material is there. All Panchavata I told. Yes, coming to the case discussion, what your topic, little bit theory is over now. For every case I discuss, I'll give one example. These are things which I am dealing now. What happens when stroke happens? These areas you should know because which person will get speech back, which person will not get back. You have to predict it because nowadays MRI is there, you can predict. If MRI was not there, then there was no problem. Coming to the first disc, already in the morning session it has happened, but as it's the rarest case, this publication has given me more than 1,000 engineers as a patient, my patients. Search in Google in my name. Without surgery, I want to cure my spine. My article will come because it is PubMed, Web of Science, all indexed journal. It's a 100% resolution of a disc. A patient slept on a surgeon from Hubli. She took a discharge and came to directly my hospital. She's a lady. There is a 100% resolution. Either this is before, this is after. I have not did the post MRI because I am a poor patient doctor. The patient itself is that she's an interested lady. Sir, how I got cured? I want to see. She only went and brought the report back. After that, I have did more than 150 MRI repeat. Now the latest publication will come with that. This is what has happened. There was a bulge. This is before treatment. This is after treatment. 4 course of Shodhana Basti. It may be Eranda Mula Shodhana Basti, Dashamula Shodhana Basti, or Vaitarna Basti. Nothing I am majorly you. Simple. 4 course. 1 Virechana. Then Rajayapana Basti, 2 course. This is the outcome. Oral medicine. Acute phase from Rasna Erandadi Kashayam, Danada Nayanadi Kashayam, Ashtavarga Kashayam. Mahavata Vidvamsarasa, Vishamushtivati was the only prescription given. This case is documented in KL Ayurveda Hospital. They have taken, their publisher taken the patient phone number to confirm whether it really happened or not. And for this co-author is one orthopedician and one radiologist. Orthopedician has bombarded by the spine surgeons. Why you are integrating with Ayurveda people? What we have to do if you come up with such cases? This has happened with me. And after 2 publications, he removed his name from my publication. Why? Because they are my co-authors. After doing MRI, who has reported only is my patient for the same condition. It's a complete, see the complete interval resolution of L5. I have not reported. It's a report from them only. Another case, this has taken 6 to 8 months. This is only 1 month follow-up. Patient, this is recently published. This also within 1 month. 2 courses of Basti we did, resolution. Mild reduction in the canal narrowing and extending nerve indentation. Both the places it has cleared. Same combination, either if it is numbness, tingling sensation are there, use Lashuna more. My clinical tip, Ekanga Virrasa more. Vishamushtivati is there, use Vedana Pradhana, Vishamushti you use. 2 rupees or 1 rupee tablet. Mahavata Vidvamsa Rasa and Vata Kulantaka will help in severe damage cases. Because sometimes it needs to regenerate the nerve and rule out the comorbidities. If diabetic patient is there, poor prognosis. Because diabetic itself will help in the nerve inflammation. To take care of the diabetes some component. Before and after. Coming to the Pakshagata, one example. Weakness, 60-year boy is a female. Patient is lifted from Ballari to Belgaum as because my student's grandmother she is. To be frank, we have not taken, because I am not a person that every time I'll document and video. So I am not like, my students are documented. That much only. Before this, she was in unconscious stage. We have reverted her conscious, then put her RT feed. This was before treatment. Exactly after 1 month. First 5 days, only Alepa, Agni Chikitsa Lepa was given to the patient and Takradara was identified. Oral medicine, Bharatvata Chintamani was given in 125 mg OD with Gorojanadi combination and Mahamanjishtadi Kasha was given. Patient was on RT tube. I put the tongue out with honey, we rubbed on the tongue for 3 days, conscious reverted, then we crushed and put into the RT tube after that. Because sometimes medicine works in different way. Ayurveda told that I have rubbed on the tongue. But take care that there should not be any aspiration. Keep one suction machine side. If you feel, suction it. Nothing worries. It's a technology you are using for yourself. If you have a cough or something, you will take it or not. You just take it out. This is the examination, how she improved. These are the blood reports. Because she was all blood investigation tested. Because in allopathy hospital, they give blood liquefying drugs. Suddenly she may bleed. Most of the stroke patient will die not because of the brain injury. They die because of the gastric ulcer rupture. It's a stress ulcer. Don't give your all Ushna Tikshna. Take care of that. Yes, don't worry about it. But you should know that there may be bleeding. Everything is improved. Walking. Last day going, patient vomited and no more. He vomited a big bowl of blood. Because brain when go into stress, gastric ulcer will develop. Okay, that you have to keep in mind. Another case from Rajasthan. This case from Rajasthan. Fight between husband and wife. She drank good night liquidator. Good night liquidator and quadriplegia patient. She came on stretcher. She was admitted 2 years here. up from the floor. 27th of April 2020, I discharged. That was the locking day. On that day, they went to Rajasthan back. Okay? Post neuropathy also done. There is no change in the nerve pathology, but there is a 100% recovery by the muscle. This is the best case. I did a post-test NCV also, because sometime a person who is giving the report is also old treating a patient, same doctor. There is no change in the nerve study, but improvement. Yes, I gave starting Swarnamalini Vasanta because it's a Dhatugata Jora Lakshanas. Dhatugata deeper tissues are involved with butter every day TID dose. Then she recovered. Then Vata Kulantaka, Vata Gajankusha, Mahavata Vidvamsarasa, some Rajapana Basti in sequence permitted. I have treated on the line of Urustamba Chikitsa. Polyneuropathy, Urustamba. Externally, I did only Danyamla Parisheka or the Shimulaka Shah Parisheka. No Abhanga. Once she recovered, started regaining the power, then we did Pijichil, Sarvanga, Taila Seka, then Rajapana Basti for 4 sittings. She improved. Now you cannot identify only she is the same patient. Another case, disc herniation. See, this case is a red flag say. That's why I brought this here. Why? Because this case may improve with surgery if the surgeon is good. Question is two mind. Whether you have to refer or not, you refer to a great hand surgeon so that it will improve. See there. This is what a classical Gridrasi, he like a Gridram. Because there is the inferior migration of the content. The content has came into down. To take the content from the L4 and L5, it is like a quada equina. The girl's hair, if you touch one fiber, that part will be not working. So Ayurveda is working very good, but it's injustice to that patient. But this patient, we improved it. He has given consent that no sir, I will not go for surgery. Yes, you take a consent, high risk and treat. We are having a fear that take consent. Write them on paper. It's my own interest. I came to Ayurveda, put them signature. Take and treat. I'm not telling that damage the patient. Because your safety also is very important. One patient may harm your whole career. He's from Gadar. He's about to marry. Because of the marriage preparation, he working as a garden, everything, making new wife is coming. He lifted one konda and gone. His marriage was postponed for 2 years further because of this event. Not able to stand, walk also. After the treatment, both husband and wife last week came and met me and gave me sweets, sir. I have improved 100%. Same, central clinal stenosis, Urustamba Chikitsa, starting, Raja Apanabasti was given to this patient. Hardly I use Vishamushtivati more. If Vedana is not responding for Vishamushtivati, next higher strength is Navajivana Rasa you can use. Navajivana Rasa. Then Trayodashanga Gugulu was given higher because it is Katigraha Samprapti induced. It is not Gridrasi exactly. Katigraha Samprapti, Kapha has to be treated more. This is the MRI. Fold reduction of the curvature of the spine has improved. Cervical myelopathy, compressions. See, presentation is somewhere else. The presentation is, see there is a clonus. This is the danger sign. It's upper motor neuron. This is Kevala Vata Vyadhi. Here you have to do Snehana more. Okay? And boy, is a dropped out from our Kaili, another hospital, is an tubercular encephalitis. Their last stage. To be frank, I was going for lunch to home. Then sir, Ramanav sir called me, one patient, he's there in the Bolero only, you have to see there itself. Okay sir, I told. I'll come and saw that patient. Sir, continuous vomiting, sir, is not able to, already 6 months, they tried with all anti-tubercular drug, not working. I told, I'll give 10 tablets. 2 tablets, each 10. If your son responded in within 3 days, I'll handle it. If he has not responded, even I am not going to help you, sir, more, because already it is very severe case. 2 times shunting done, failed. Young boy. This is the scene. I gave him Suta Sakar with gold, 1 tablet TID, Bharatvata Chintamani 1 TID for 3 days. Then Bhadradarvadi Kashaya, first shloka Mahavata Vyadhyadhyaya. Bhadradarvadi, I think he has written in cans together. He record. Shushita Refriksham Bhadradarvadi Kashaya. No Panchakarma, nothing I did for this boy. Only oral medicine has, because it's an inflammatory mediated disorder. You have to treat in the principle of Vata Vyadhi as also, Jora also. His father is very good person that he has taken care everything. He has really, how we told, he put medicine. He has recovered. Same case from Bijapur. Same case. His improvement was poor. Orientation was lost, then able to get a orientation by some days. Afterwards, patient was not having well to do with gold component preparation. Even I don't have any other weapon to treat. Something we helped him, but patient is not ready to. But he has taken a discharge against 1 month medication, not came back. No follow-up. This patient was not improved even with 15 days medication. Only orientation came. He is asking to talk, he is talking. That was not there first day. This is my career first patient which I treated in 2013 or maybe, or 14. Nerve conduction study. The study is mildly abnormal and reveals evidence of mild demyelinating motor sensor. Because admitted within 3 days, he approached me. He came to me on Thursday night. Sunday, boy walked to canteen. This is there in YouTube channel. His father has put into YouTube. By looking this update from Republic TV, one panelist having the same complaint, he came for the therapy. He is also improved. Acute demyelination disease, a fever, febrile illness followed by a demyelination. Here also, Mrutyunjaya Rasa, Suvarna Malini Vasanta. 1 OD, Mrutyunjaya, 1 TID, Amruta Risa has treated the condition. But to recover his muscle power, we did Rajapanabasti post. The symptoms easy, abnormal reveals. Yes, this is Amog. He is totally, completely recovered from the patient. He has completely recovered. Another one is delayed milestone. This is the area where you can, because there is no medicine in allopathy to treat this delayed milestone, cerebral palsy, mental retardation. This is our area where really you have to work. We are not giving him, even 1% improvement also very important. This is the MRI, both history. This is a syringomyelia case. There is a big water content in the spinal canal. This has been treated with Yogendra Rasa and Bharatvata Chintamani. He was not able to even move his finger. This has started by 3rd day. By 3rd day, you can see he can lift his leg from patient from Yellapur. He came COVID positive when he came to our hospital. That's why we treated only oral medicine. By oral medicine only he has achieved this much. Now he is walking, sir. Everything is fine. Sensory motor neuropathy. NCV study evidence of diffuse sensory motor agonopathy, and there is the cervical myelopathy. Both are there. This is the case of compression. Now he can move his foot drop there. It was improved. Craniotomy. Don't worry that Ayurveda will not handle the craniotomy. After recovery, we send him back to fit his cranium back, because his autonomous system was not working back. Then this patient daughter is a gynecologist at KL Hospital. She brought this case. She treat my father. He's a school teacher. Sardarji, we had treated him, walking, everything fine. Then he went back and fitted his backbone. This is the, here is a stroke, schwannomas, also tumors. Over. Yes, yes, yes. This is another case, demyelination. That's why in stroke, within 1 week, patient become fine. It's a demyelination disorder. Only one tablet, Suvarna Malini Vasanta, was treated the boy. Only one tablet. This all needs something. These are the publications. Annals of Ayurveda. This is the article. These are the bastis which I want to give, that I'll drop the basti. What basti I have not explained because sir needs a prescription. What basti I have practiced, I have put everything here. Thank you for the patient listening. Any questions you can drop your email or questions in panel session, I can answer you.
इल्म की रोशनी से आपने मंच जगाया, इल्म की रोशनी से आपने मंच जगाया, हर दिल में नए जज्बा जगाया. Thank you so much, sir, for such a wonderful and informative session. Please give a big round of applause to our esteemed speaker.
ಡಾಕ್ಟರ್ ವಿಶ್ವನಾಥ್ ವಸೇದಾರ್ ಸರ್ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಇವರ ಸನ್ಮಾನ ಕಾರ್ಯಕ್ರಮವನ್ನು ಡಾಕ್ಟರ್ ಗಿರೀಶ್ ಕುಪ್ಪಸ್ಗೌಡರ್, ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಹಿರೇಮಠ್, ಡಾಕ್ಟರ್ ಎಸ್ ಜಿ ತಲೆಗೌಡರ್, ಡಾಕ್ಟರ್ ಎಸ್ ಬಿ ದೇಸಾಯಿ ಅವರು ನಡೆಸಿಕೊಡಬೇಕೆಂದು ವಿನಂತಿ. ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು.
Sorry, I thank the organizers and Balreddy sir who have given me opportunity to share my experience. Thank you very much. It's a great initiative by the federation. First time such things should happen so that you will be oriented. Thank you very much, sir.
Now,
SNA ಕಂಪನಿಯಿಂದ 2 ನಿಮಿಷ ತಮ್ಮ ಕಂಪನಿಯ ಬಗ್ಗೆ ಹೇಳಲಿದ್ದಾರೆ. ಸ್ವಾಗತ.
Now I request Dr. Vijay Lakshmi Angadi to come forward and give us a brief introduction of our next speaker, Dr. Sukumari H.U.
Thank you. Thank you for having me here. Good noon to everyone. It's a pleasure to welcome you all for the introductory speech. So, how many of you have ever overwhelmed by the amount of information we gather daily? I think no one. So, it's the time to welcome a great speaker. Today, we'll shed a light on how to navigate this information overload. So, it is my distinct pleasure to introduce the charming and lady. The name itself indicates Dr. Sukumari ma'am by the knowledge and by the grace from Rajatgiri, Dharwad. Ma'am Dr. Sukumari ma'am, multilinguistic, well known in English, Kannada, Tamil, Hindi. Today we have the privilege of being in the presence of true visionary person in the field of naturopathy and yogic science and psychotherapy. Our innovative solution for a greener and more sustainable future. Ma'am has successfully spearheaded numerous graduations in BSc, Bachelor of Science, from Sharana Basveshwar College, Gulbarga, and BNYS, Bachelor of Naturopathy and Yogic Science in GSS Institute of Naturopathy, Yogic Science, Ooty, MS in Counseling and Psychotherapy, Coimbatore University, Shimoga. With over decade, ma'am has passionate as a lecturer and head in yoga department, BD Jati Homeopathy College, Dharwad. Lead the yoga department, overseeing curriculum design and practical training. Deliver lectures and practical sessions on yoga's therapeutic applications. Drive triapital initiatives focused on health promotion and well-being. But it's not just your professional achievements that make her special. Some more achievements she has made it. She has in public engagement and health education, delivered numerous lectures and workshops on health, wellness, educational, institutional, community worker. Regular speaker on radio and television, promoting natural health practices. Published multiple articles in the newspapers and magazines as a preventive healthcare and mental well-being. So another key skill she's having is marvelous naturopathy in yoga therapy and stress management and lifestyle counseling, public speaking, holistic healing, counseling, academic teaching, and curriculum developing. So it's a greatest journey of 1,000 miles. Begin with a single step. So thanks for patience listening and thanks for the opportunity. Thanks to AFI. Please welcome ma'am.
Thank you.
Thank you, Dr. Vijay Lakshmi. Good afternoon, all. Health is wealth. Healthy nerves, happy life. I would like to share few things about how we can manage through yoga and naturopathy neurological disorders. Our brains controls everything we do. Walking, thinking, breathing, movement, memory, everything. It is the command center of our body. Actually, people all over the world suffering from neurological disorders. Neurological disorders, a various group of conditions that affect structure or function of our nervous system, mainly brain, spinal cord, and peripheral nerves. Neurological disorders present a profound, complicated challenges impacting not only physical structure, but also cognitive, emotion, and autonomic system. It reduces patients' quality of life. If we see the causes are varied. It may be genetic, infections, nutritional deficiency, severe injury, blood vessels problems. One more thing, all are exposing regularly for that. Plastics, what we ate, our breakfast, lunch and all. Plastic also, researchers found microplastics in human brain. So plastic also one of the cause of neurological disorders. This one. Sorry. Symptoms are also varied. Uh, Actually, it depending on specific conditions, but also include weakness, pain, numbness, stiffness, loss of memory, loss of coordination, tremor, severe headache, and so on. Now, let us see how we can manage neurological disorders through yoga and naturopathy. Yoga and naturopathy both are a holistic approach. We can manage, let us see first how yoga can manage neurological disorders. Yoga, all of you know, yoga is our ancient method of practice. It's a science of living and perfect lifestyle. Actually, all of you know, it is a wonderful gift of our ancestors to the whole world. Several studies have done, have shown the effect of it. Says yoga is a excellent remedy for neurological disorders. It says if we practice yoga regularly, it stimulates neuroplasticity, our brain's ability to change and rewire itself. And it also changes, reshape the structure and enhance brain function. Our body produces stress hormones when we get anger, stress, tension, depression, physical or mental stress. During that time, cortisols will produce. From yoga, if you practice regular yoga, you can reduce that cortisol level. And yoga also activates parasympathetic nervous system. It is linked to rest and repair state of our body. And it also improves blood flow through the brain. To the brain, it provides nutrition and oxygen, and sufficient oxygen. And it stimulates brain-derived neurotrophic factor. It is a proton which is present in our brain, mainly linked to our learning, planning, and all over cognitive functions. And it increases GABA, gamma amino butyric acid, and alpha and theta waves. They are very beneficial in managing neurological disorders. These are linked to creativity and relaxation. And it also releases serotonins, endorphins, and neuropeptides. Serotonins are, scientists called it as happy hormones, and endorphins are called as natural painkillers. They are very beneficial in managing neurological disorders. And it also improves gray matter volume in hippocampus and prefrontal cortex. Hippocampus is linked to planning and memory power, and prefrontal cortex is linked to decision making and learning. And it also decreases the volume of amygdala. If it is responsible for our brain's stress and emotion center. If it reduces size and volume, automatically stress will be reduced. And these are some of exercises related to neurological disorders. These things, we have to stretch our hands slowly. and it is cat stretching. Patient should raise left leg, right hand, and vice versa. Right leg, left hand. And this is called Pavanamuktasana stretching. They have to bend their leg with inhalation, and while exhaling, they have to stretch. And one leg rising exercise also, they can rotate their leg. They can try. Asanas, if we come to asanas, Tadasana, it activates our whole nervous system and improves balance. Vrukshasana, it strengthens our legs and also improves balance and coordination and improves concentration. Trikonasana, it also strengthens our thighs, hands and hamstring muscles, back. And Hasta Uttanasana, it also strengthens our spinal cord, activates nervous system. Setu Bandhansana is very effective asana in neurological disorders. It produces dopamine, and it also produces endorphins. It improves circulation to the brain. It strengthens our back and legs. And Utkatasana, it activates our brain function and strengthens our lower body. Ardha Chakrasana, it is also very beneficial. It produces dopamine, neuropeptides and endorphins. Veerabhadrasana, it activates our whole body, actually improves coordination, memory power and balance. It strengthens legs, hands, whole body. Paschimottanasana also improves circulation to the brain, and with slow breathing while exhaling we have to bend. That releases that dopamine and endorphins. It strengthens our back and legs. Supta Udara Karshasana, spinal twist postures. This one and this one, these both asanas are very beneficial in paralysis. It activates nervous system and it improves circulation also. These are very good asanas for paralysis and Parkinson also. If we come pranayama, pranayama is a breathing technique, a rhythmic breathing technique. What we are doing, respiration or breathing is shallow breathing. In this we cannot expel all carbon dioxide from our lungs. When we take a deep breath, we can remove carbon dioxide from our lungs and can take more means sufficient oxygen to our body. So for neurological disorders, two simple pranayamas are very beneficial. One is deep breathing and another one is alternate nostril or anulom vilom pranayama. In deep breathing, we have to take slow and deep breathing, that's all. Slowly we have to, according to our capacity, we have to inhale and slowly we have to exhale. This is one type. Anulom viloma pranayama, we have to close our right nostril and inhale through our left nostril. Then we have to close our left, exhale to the right. Again, we have to inhale through the right, exhale to the left. This is one round. These two are very beneficial. They improve circulation to the brain and memory power, confusion, what they are having, confusion, tremor, lack of concentration. These things they can fulfill through this pranayama, these two. It improves balance also. It relaxes their nervous system, calms their mind. And one more pranayama is there, Brahmari pranayama. This is also very beneficial. Actually, while this one, we have to make humming sound, humming bee sound. We have to close our ear and eyes and make sound like this. This humming sound, vibration will occur in our brain. This releases nitric oxide. Recent study shows that this nitric oxide dilates our nasal passage blood vessels, vasodilation effect. So it improves circulation to our brain and it improves cognitive function also. Same thing while making humming sound, it vibrates our mind, it activates our vagus nerve. So it improves circulation again, it improves function, and it expands our chest. It's good for heart and lungs also. Another one thing we can chant akara, ukara, makara. These things also omkara totally. That is also very beneficial. And the next, meditation. Meditation, simple meditation is omkara. Two types are of very beneficial in neurological disorders. One is omkara meditation. Another one is mindful meditation. In omkara meditation, again we have to chant om. This vibration will increase our circulation. It keeps our mind calm, and it keeps nervous system calmness will occur. And another one is mindful meditation. We have to concentrate live things, whatever that breathing, maybe our thoughts. We have to concentrate our breathing only. Inhalation, exhalation, we have to focus on that. And we can observe during that time that our body movements, our abdomen movements, our chest movements, we have to concentrate there. Another one, observation of thoughts which are moving in our mind. Simply we have to observe. We should not concentrate in any one particular subject. These two types are very beneficial for neurological disorders. Not only neurological disorders, for all the health issues, it is very beneficial. And Shavasana. Without Shavasana, yoga cannot be completed. Shavasana, all bodies, muscles, organs, nerves, everything will be relaxed, and it calms our mind. And it in Shavasana also, parasympathetic nervous system will be activated. So Shavasana is very beneficial. Then we come to naturopathy system. Naturopathy is a drugless system, a healing system. In this, naturopathy focus on using healing power of nature and body's own ability to heal itself. Naturopathy believes our body has own healing capacity. Just we have to activate that ability. In this, therapeutic modalities are so many: diet therapy, massage therapy, mud therapy, acupuncture, acupressure, etc. If we come to diet therapy, aharadinam arogyam, we say food is the foundation of our health. So if we eat nutritious food, definitely we can get a good health. Another one famous saying is there: when diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. So diet plays very important role in our health. In this, for neurological disorders particularly, we have to eat fresh leafy vegetables, fruits, nuts, and berries. This curcumin present in turmeric, resveratrol present in grapes. These two things are neuroprotective, and they contain antioxidant and anti-inflammatory properties. So they are very useful in nervous system health. And omega-3 fatty acids, it's for brain cell structure and function. Antioxidants protects brain cells from damage. Vitamin B, important for neurotransmitter production and overall brain function. So diet is very important for neurological We can cure half of the problems by diet only, if we take proper nutritious diet. And hydrotherapy, this is immersion bath. Warm immersion bath is very beneficial. It reduces spasticity and nervous tension. And massage therapy, it activates our whole nervous system, it relaxes again our tensed nerves and relaxes our muscles, improves circulation, and it also produces, activates sympathetic nervous system. So massage and immersion bath is very beneficial in neurological disorders. Also mud therapy. It's soothing and cooling effect, anti-inflammatory properties. It gives, it's very useful to reduce pain, inflammation and stress. Also edema. We can reduce pain and edema by applying mud and acupressure. It is a, if we give particular specific point in our body to activate that particular part to concern to that problems, what patients are suffering, it's very beneficial. The GB20, GV20 and GB20 points, and another one is LI4. These are beneficial in neurological disorders. In heliotherapy, vitamin D plays a crucial role in neurological disorders. And vitamin D, vitamin C, vitamin A also beneficial in neurological disorders. These vitamin D protects neurons from the damage by oxidative stress and inflammation, and it produces and balances neurotrophic factors. And it influences neurotransmitters. So regularly we have to expose 15 to 20 minutes for sun rays is beneficial, not only nervous system problems, all the problems we will, actually vitamin D we have to take naturally, not in supplements form. So we have to expose regularly to sun rays. Thank you. Thank you very much for giving this opportunity to share a few of my things here. I am very much thankful to Dr. Abhinandan sir and all the organizing committee and who are sitting here, you also. Thank you very much.
योग के सफ़र में ढूंढो अपनी पहचान, योग के सफ़र में ढूंढो अपनी पहचान, सेहत, सुकून और सुख की ये है शान. Thank you, ma'am, for sharing such a wonderful and excellent insights into yogic science and naturopathy. Thank you so much.
ಡಾಕ್ಟರ್ ಸುಕುಮಾರಿ ಮೇಡಮ್ ಅವರಿಗೆ ಸನ್ಮಾನ ಕಾರ್ಯಕ್ರಮವನ್ನು ನೆರವೇರಿಸಲು ಡಾಕ್ಟರ್ ಹೇಮಾ, ಡಾಕ್ಟರ್ ಭಾರತಿ, ಡಾಕ್ಟರ್ ರಕ್ಷಾ ಹಾಗೂ ಡಾಕ್ಟರ್ ಕೋಮಲ್ ರವರನ್ನ ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ. ರೆಡಿ ಅಲ್ಲ? ರೆಡಿ.
Thank you, ma'am.
ಥ್ಯಾಂಕ್ ಯು ಎವ್ರಿವನ್. SNA ಔಷಧಾಲಯ ಕೇರಳ ರವರು ತಮ್ಮ ಕಂಪನಿಯ ಕುರಿತಾಗಿ ಒಂದೆರಡು ಮಾತುಗಳನ್ನು ಹೇಳಲಿದ್ದಾರೆ. ಸ್ವಾಗತ. ಪ್ಲೀಸ್ ಡು ಕಮ್.
We kindly request all the delegates to set their mobile devices to silent mode. Thank you for your cooperation.
of time. But since it is a cream, it is very easy to apply in a rectal area when there is a fissure or when there is a fistula. We can apply Jatyadikritam on that area, keep it over 4 times. And even when a person is on travel, he can apply, just go to washroom and apply that area. Not only a skin, it can extend it to anorectal areas, it can extend it to vaginal areas, even it can extend it to many areas, even the private parts, where with the cream, just like a cream, we can use it. Another important thing of our cream is that it can handle very easily. Like for example, when we carry an oil, it may get spilled over, the packaging may have limitations, and many challenges are there. That also overcome by Ayur cream because it's in very easy handling form, and moreover it can be kept for long period of time with more deeper potentials. SNA Ayur cream is a blend of traditional knowledge with a modern convenience. As we know, many of the oils when we use in our practice, it has a limitations in its application. But the Ayur cream can overcome those challenges. Even for the very sensitive skin people can use Ayur cream very effectively without making any skin challenges. It is easy to be used, convenient with a proper dosage form, and it's also very effective in any topical application. Moreover, the challenges many of the classical formulation face, like kridam or coconut oil base, which have a reflections in different climatological conditions, with different ethnic practices too. Hence, Ayurvedic cream, especially Ayur cream of SNA, has a great role to play because it keep its stability even different extreme temperature and extreme situations. Hence, Ayur cream can be a wonderful medicine used in different areas. And I believe SNA Ayur cream will open up new era of pharmaceutical form areas, and it can reach to the different part of the world.
Hello, good afternoon everybody. And here we are with a new modern form change for for thylums and all clinics. Okay, then it's the Ayur cream. So we from SNA ourselves, it is an industry from 1920. It has been inspired, and there has been a lot of tradition, Ayurvedic tradition, and we are there having a hospital. Everything is there. Then blended tradition with innovation. Then we are here. We are trying to change the form change of the stylum to a cream form. So this is an innovation to have a traditional Ayurvedic cream. And then why the Ayur cream is that? Because nowadays we had shown that the topical application of our classical oils, because the classical tradition is now going everywhere, but the OP-wise use of classical tradition is declining due to the sticky oils or topical application, time consuming, all these are declining. So that's why, and the clinical impact also, we had the follow-up therapy after the Panchakarma therapy, we cannot also not follow that. And then current alternative, there is ointment is there, but the ointment is which is mixed with a balm and oil, and it is also again having these problems with the having a lot of problems with the stickiness and greasiness, and all that happens is that when you apply the oil on external application, it will be easily erased. Okay, so that so there may be a problem with the oils on the body. So it's an oil water emulsion with the fine droplets are dispersed in water, and improved penetration and absorption, increased skin hydration, enhances spreadability and non-greasy advantage. So that is the main advantage for this, and oil is converted to a cream. So when we are just moved with an topical application modern format, we are just had an advantage over the ointment, because ointment is just like the oil. Okay, and okay, okay, and then the amount of application. So this is the formulation, stability, and this is the difference between the cream and the conventional ointment. We had this type of Dhanadram Thailam. These are the creams. Okay. For the cream, and all this Likucha Thailam, Chambratyadi, Jivantyadi, Jatyadi, Karpuradi, Kotakal, Mahadikta Gridam. Okay. And all these Thailams will be coming in the cream format. So it has been an added advantage to your clinical practice, and we are preserving the traditional formulations, because a lot of patent formulations are available now. So, but not losing our traditional formulation, we are just creating this one, and this will not be an alternative for Panchakarma therapy, because this is only for topical application. You should rely on this all the classical traditional oils, and by by OP management, you can use this one for this as a skin hydration. All those many skin diseases we can manage with this one, with a better hydration, and the people can leave it over there. Thank you.
Thank you, sir. Dear students, doctors, internees, if you have any query regarding the topics covered, please write them in a question box. Our panel will be happy to answer them during the discussion. Now I request Dr. Basavaraj Angadi to come forward and give us a brief introduction of our next speaker, Vaidya Malhar Joshi.
ಶುಭ ಸಂಜೆ. ರಾಷ್ಟ್ರೀಯ ಗುರುಗಳು ಹಾಗೂ ಕೇಂದ್ರ ಆಯುರ್ವೇದಿಕ್ ವ್ಯಾಸಪೀಠ ಸಮಿತಿಯ ಉಪಾಧ್ಯಕ್ಷರಾದಂಥ ವೈದ್ಯ ಮಲ್ಹಾರ್ ಪ್ರಭಾಕರ್ ಜೋಶಿಯವರು ಜನಿಸಿದ್ದು 11ನೇ ಸೆಪ್ಟೆಂಬರ್ 1968ರಲ್ಲಿ. ಇವರು ತಮ್ಮ ಆಯುರ್ವೇದಾಚಾರ್ಯ ಅಂದರೆ BAMS ಪದವಿಯನ್ನು VPAM ಕಾಲೇಜ್ ಸಾಂಗ್ಲಿಯಲ್ಲಿ ಮುಗಿಸಿದರು. 1990ರಲ್ಲಿ ಸಾಂಗ್ಲಿಯ ಮಾಧವನಗರದಲ್ಲಿ ತಮ್ಮ ವೈದ್ಯ ವೃತ್ತಿ ಪ್ರಾರಂಭಿಸಿದಾಗ ಅಲ್ಲಿ ಅನೇಕ ಬಡವರನ್ನು ಗುರುತಿಸಿ, ಅಂದರೆ ಬ್ಯಾಕ್ವರ್ಡ್ಲಿ ಹಿಂದುಳಿದಂಥ ಜನರನ್ನು ಗುರುತಿಸಿ ಅವರು ತಮ್ಮ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಷನನ್ನು ತಾವೇ ಪ್ರಿಪೇರ್ ಮಾಡಲು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದರು. ಅತಿ ಕಡಿಮೆ ಬೆಲೆಯಲ್ಲಿ ಹೆಚ್ಚಿನ ಗುಣಮಟ್ಟದ ಔಷಧಿಗಳನ್ನು ತಾವೇ ಸ್ವತಃ ತಯಾರಿಸಿದರು. ರೋಗವನ್ನು ಮೂಲದಿಂದ ತೆಗೆಯುವ ಉದ್ದೇಶದಿಂದ ರಸೌಷಧಗಳು ಮತ್ತು ಗುಗ್ಗಳ ಭಸ್ಮಗಳನ್ನು ತಯಾರಿಸಿದರು. 100ಕ್ಕಿಂತಲೂ ಹೆಚ್ಚು ಒಂದು ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಮತ್ತು ವೈದ್ಯರಿಗೆ ಲೈವ್ ವರ್ಕ್ಶಾಪ್ಗಳನ್ನು ಇವಾಗ ಪ್ರೆಸೆಂಟ್ ಮಾಡ್ತಾರೆ, ಲೈವ್ ವರ್ಕ್ಶಾಪ್. ಅದೇ ರೀತಿ ಲೈವ್ ವರ್ಕ್ಶಾಪ್ ಮತ್ತು ಸೆಮಿನಾರ್ಗಳನ್ನು ಕೊಟ್ಟಿದ್ದಾರೆ. ಹಾಗೆ ಸಾಕಷ್ಟು ವೈದ್ಯರಿಗೆ ಇದು ಅನುಕೂಲ ಕೂಡ ಆಗಿದೆ. ಇವರು ಪಂಚಕರ್ಮ ಮತ್ತು ಪಂಚಭೂಟಿಕ ಚಿಕಿತ್ಸೆಗಳಲ್ಲಿ ನಿಪುಣತೆಯನ್ನು ಹೊಂದಿದ್ದಾರೆ. ಹಾಗೆ 2000ನೇ ಇಸ್ವಿಯಲ್ಲಿ ಆಯುರ್ವೇದ ವ್ಯಾಸಪೀಠ ಸಾಂಗ್ಲಿಯ ಅಧ್ಯಕ್ಷರಾಗಿದ್ದಾರೆ. ಹಾಗೂ 2006ನೇ ಇಸ್ವಿಯಲ್ಲಿ ಮಹಾರಾಷ್ಟ್ರದ ಪಶ್ಚಿಮ ಘಟಕದ ಆಯುರ್ವೇದ ವ್ಯಾಸಪೀಠದ ಅಧ್ಯಕ್ಷರಾಗಿಯೂ, ಹಾಗೂ 2022ರಲ್ಲಿ ಗೌರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾ ಆಯುಷ್ ವಿಭಾಗ ಏನಿದೆ ಅದು ಇವರಿಗೆ ರಾಷ್ಟ್ರೀಯ ಗುರು ಎಂದು ಗೌರವಿಸಲಾಗಿದೆ. ಹಾಗೆ ಸದ್ಯದಲ್ಲಿ ಇವರು ಆಯುರ್ವೇದಿಕ್ ವ್ಯಾಸಪೀಠ ಸಮಿತಿಯ ಉಪಾಧ್ಯಕ್ಷರು, ಅಂದರೆ ಭಾರತದ ಆಯುರ್ವೇದ ವ್ಯಾಸಪೀಠದ ಉಪಾಧ್ಯಕ್ಷರಾಗಿ ಸೇವೆ ಸಲ್ಲಿಸುತ್ತಿದ್ದಾರೆ. ಇವರ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಔಷಧ ತಯಾರಿಕಾ ವಿಭಾಗ, ಪಂಚಕರ್ಮ ವಿಭಾಗ, ಅಗ್ನಿಕರ್ಮ ವಿಭಾಗ, ವಿದ್ಕರ್ಮ ವಿಭಾಗ, ಹಾಗೂ ಆಮವಾತ, ಜಲೋಧರಕ, ಹಾಗೂ ಕಿಡ್ನಿ ಡಿಸೀಸಸ್, ಲಿವರ್ ಡಿಸೀಸಸ್ ಹಾಗೂ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳು ಕೂಡ ಟ್ರೀಟ್ಮೆಂಟ್ ದೊರೆಯಲಿದೆ. ಧನ್ಯವಾದಗಳು ಆಯುಷ್ ಫೆಡರೇಷನ್ ಆಫ್ ಇಂಡಿಯಾ ಹಾಗೆ ಆಯುರ್ವೇದ ವ್ಯಾಸಪೀಠ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
Please welcome, sir. Mike.
ड्रेस मेरे स्टूडेंट को चाहिए। हाँ, वो बोलेगा मैं ट्रीटमेंट दिखाऊंगा। हाँ, वो लाने को बोलो उसको। नमस्कार। हाँ वो है ना। हाँ? सलोनी कहाँ है? सलोनी को बोला। हाँ, 2 मिनिट बोलतो आणि सुरू करतो। ऐक तो मला नको आहे तो मी सगळं कृतीक करतो। तुम्ही बोलता ना याच्यामध्ये हा हा बोलतो तो कानडीत बोलतो होय मग याला तुम्ही हे घालून घ्या। नमस्कार। अभी मेरा परिचय कन्नड़ में किया है, मुझे कुछ भी समझ में नहीं आया। आगे आयोजक जो है, संयोजक जो है, उन्होंने मुझे सबके बाद यानी आखिरी सेशन दिया है। तो अब मेरी अवस्था ऐसी है, 4 बहुत अच्छे वक्तों ने लेक्चर्स दिए हैं, अब मुझे बोलने के लिए कुछ भी नहीं रहा। संयोजक ने भी वही चाहा होगा कि मैं ऊपर आ जाऊं, कुछ बोलना नहीं है मैंने, तो इसलिए मैं अभी आपके सामने कुछ भी नहीं बोलूंगा, लेकिन कुछ करके दिखाऊंगा। इसलिए मुझे ये आखिरी सेशन दिया गया है। 1-2 मिनट में हम प्रक्रिया शुरू करने वाले हैं। सबसे पहले मैं ज़्यादा स्टूडेंट लोग दिख रहे हैं, उनमें से सभी को पूछता हूँ, इसमें से प्रैक्टिस मैं करने वाला हूँ, ऐसे कौन कौन लोग हैं? मैं प्रैक्टिस करना चाहता हूँ। यह एकेडमिक हाँ बस बहुत सारे लोग हैं। एकेडमिक में जाने वाले भी बहुत सारे हो सकते हैं, प्रैक्टिस में आने वाले भी बहुत सारे लोग हो सकते हैं। प्रैक्टिस में सबसे पहले हमारे सामने एक बहुत बड़ा चैलेंज रहता है, पेन यानी शूल कम करना। आज न्यूरोलॉजिकल डिसऑर्डर पर पूरा दिन भर हमने बहुत कुछ सुना है, लेकिन हमारे ओपीडी में जहाँ बैठने के लिए भी जगह नहीं हो सकती, इतनी छोटी जगह में अच्छे तरीके से हम पेन मैनेजमेंट कैसे कर सकते हैं, और वो भी शुद्ध आयुर्वेदिक चिकित्सा से। इसका डेमोन्स्ट्रेशन मैं अभी यहाँ दिखाने वाला हूँ। जैसा मेरा परिचय कन्नड़ में कर दिया, वैसे ही यहाँ कुछ मराठी स्टूडेंट भी है। मी त्यांच्यापैकी कोणाला तरी विचारतो की नासाविथ हे एक कर्म नस्य हे स्वतःवर करून घ्यायला कुणी तयार असेल तर हात वर करा आणि समोर या, नाहीतर माझे दोन्ही स्टुडंट तयार आहेत। चद्दर लाइए, चद्दर लाइए, ओढ़नी पैर पे ऊपर डाल देना, इस हाथ में खड़ी रहो। हमारा तेल थोडं रब कर, तेल सोड आणि एक तुझा मित्र माहिती शकतात का विचारून घे, लगेच त्याला नासाविद्य करून जातो. तुझं स्नेहन करूया तोपर्यंत फोन वगैरे आहे का तुझ्याकडं? आला का? मस्त विचार की आणि कोणा मुलगा चालेल मुलगी चालेल, मग लगेच ये पटकन आणि चल. पूरब कर ले, पूरब कर ले. नहीं रुमाल नहीं चाहिए अभी, तू डाल ना, ग्लोव्स डाल कर. सुजाता ने हाँ स्नेहन से तुम कर लो. दोनों हाथ में पहन लो. मैं बोलता रहूँगा, शिवा बोलता रहेगा. शिवा हाँ मैं तो पहले नस्य के बारे में बोलना शुरू करो कन्नड़ में. शुरू कर, ये वो आ जाएगी.
ನಮಸ್ತೆ, ನನ್ನ ಹೆಸರು ಶಿವಕುಮಾರ್ ಅಂತ. CRAV ಎಕ್ಸಾಮ್ ಅಂದರೆ BMS ಇಂಟರ್ನ್ಶಿಪ್ ಮುಗಿಸಿ ಕೋರ್ಸ್ ಆಫ್ ರಾಷ್ಟ್ರೀಯ ಆಯುರ್ವಿದ್ಯಾಪೀಠ ಅಂತೇಳಿ ಸೆಂಟ್ರಲ್ ಗೌರ್ಮೆಂಟ್ದು ಒಂದು ಕೋರ್ಸ್ ಬರುತ್ತೆ, 1 year ಕೋರ್ಸ್ ವಿತ್ ಸ್ಟೈಪಂಡ್. ಎಕ್ಸಾಮ್ ಬರೆದು ನಮಗೆ ಮಾರ್ಕ್ಸ್ ಅನುಗುಣವಾಗಿ ಸರ್ ಅಂಡರಲ್ಲಿ 1 year ಸೆಲೆಕ್ಟ್ ಆಗಿದ್ದೇನೆ ನಾನೀಗ. ಆಲ್ರೆಡಿ ನಂದು 4 month ಕಂಪ್ಲೀಟ್ ಆಗಿದೆ ಸರ್ ಹತ್ರ. ಇವತ್ತು ನಾವು 3 ಪ್ರೊಸೀಜರ್ಸ್ ಇಲ್ಲಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಬೇಕಂತ ಬಂದಿದ್ದೇವೆ. 2 ಪ್ಯಾರಾಸರ್ಜಿಕಲ್ ಪ್ರೊಸೀಜರ್ಸ್, 1 ಪಂಚಕರ್ಮದು. ನಮಗೆಲ್ಲ ಆಯುರ್ವೇದ ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ ಗೊತ್ತಿರೋ ಹಾಗೆ ಪಂಚಕರ್ಮಲ್ಲಿ ವಮನ, ವಿರೇಚನ, ಬಸ್ತಿ, ರಕ್ತ ಮೋಕ್ಷಣ, ನಸ್ಯ. ನಾವಿಲ್ಲಿ ನಸ್ಯ ಡೆಮಾನ್ಸ್ಟ್ರೇಟ್ ಮಾಡಬೇಕಂತೇಳಿ ಬಂದಿದ್ದೇವೆ. ಮತ್ತು ಸುಶ್ರುತನ ಪ್ರಕಾರ ಶಲ್ಯಲ್ಲಿ ಪ್ಯಾರಾಸರ್ಜಿಕಲ್ ಸರ್ಜರಿ ಆಗಿರುವಂತಹ ವಿದ್ಯಾಕರ್ಮ ಮತ್ತು ಅಗ್ನಿಕರ್ಮ ಅದನ್ನು ಇಲ್ಲಿ ಡೆಮಾನ್ಸ್ಟ್ರೇಟ್ ಮಾಡಬೇಕಂತ ಬಂದಿದ್ದೇವೆ. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಅದರ್ ದೆನ್ ಆಯುರ್ವೇದ ಪೀಪಲ್, ಯುನಾನಿ, ಸಿದ್ಧ, ಹೋಮಿಯೋಪತಿ ಅವ್ರಿಗೆ ನಸ್ಯದ ಬಗ್ಗೆ ಹೇಳ್ತೇನೆ. ವಾಟ್ ಈಸ್ ನಸ್ಯ? ಸಿಂಪಲಲ್ಲಿ ಹೇಳಬೇಕಂದ್ರೆ ನ್ಯಾಸಲ್ ಇನ್ಹಲೇಷನ್ ಅಂತ ಹೇಳ್ತೀವಿ ನಾವೆಲ್ಲ. ಬಟ್ ಆಯುರ್ವೇದ ಇದಕ್ಕೆ ಒಂದು ಡಿಫ್ರೆಂಟ್, ದೇ ಎಕ್ಸ್ಪ್ರೆಸ್ಡ್ ಇಟ್ ಡಿಫ್ರೆಂಟ್ ವೇ. ಔಷಧ ಸಿದ್ಧ ಸ್ನೇಹ ನಾಸಿಕಾಭ್ಯಾಂ ದೀಯತೆ ಇತಿ ನಸ್ಯಂ. ಔಷಧ ಆಗಿರ್ಬೋದು ಅಥವಾ ಔಷಧಿಯಿಂದ ಸಿದ್ಧವಾಗಿರುವಂತಹ ಸ್ನೇಹ. ಸ್ನೇಹ ಅಂದರೆ ನಮಗೆಲ್ಲ ಗೊತ್ತಿರೋ ಹಾಗೆ ಘೃತ, ತೈಲ, ವಸ, ಮಜ್ಜ. ಅಂದರೆ ನಾರ್ಮಲ್ ಲ್ಯಾಂಗ್ವೇಜಲ್ಲಿ ಹೇಳಬೇಕಂದ್ರೆ ಘೀ, ಆಯಿಲ್, ಮಸಲ್ ಫ್ಯಾಟ್, ಈ ಥರ. ಬಟ್ ತೈಲ ಶ್ರೇಷ್ಠ ಅನ್ನೋ ಕಾರಣಕ್ಕೆ ವ್ಯವಾಯಿ.
पहले विद्या करके दिखाता हूँ, थोड़ा चेंज हुआ. हाँ बोलता हूँ. हाँ ठीक है. सबसे पहला आज का लेक्चर माइग्रेन, शिरशूल, इसके ऊपर आपने सुना है. चीट बॉक्स जो वहाँ पर रखे हैं उसमें भी शिरशूल या माइग्रेन के ऊपर बहुत सब भी आए हैं, वो मैंने देखे हैं. आपने उसके बारे में भी कौन कौन सी दवा दी जा सकती है, कौन कौन से कर्म किए जा सकते हैं, यह सुना है. अभी मैं जो प्रक्रिया आपको दिखा रहा हूँ, बहुत सारा दर्द लेकर पेशेंट हमारे सामने आता है. हमारे वेटिंग रूम में 2-4 लोग बैठे होते हैं. वो रोते रोते आता है, हम पहले उसको लेते हैं अंदर और सबसे पहले उसका शूल कम करने के लिए इंस्टेंट पेन मैनेजमेंट जो हम विद्ध कर्म करते हैं वो मैं अब आपको दिखा रहा हूं. रूटीन 26/2, 26 आधा, ये निडल है. नासा ही शिरसोद्वारम, हमें पता है. नाक में जो हम चिकित्सा करते हैं तो ऊर्ध्व जत्रु विकार में सभी जगह उसका लाभ होता है. उसी के चलते तीव्र शिरशूल में हम नासाविद्ध करने वाले हैं. वो प्रक्रिया मैं आपको दिखाता हूं. रूटीन हम इंजेक्शन जब भी लगाते हैं वैसे ही स्पिरिट का स्वाब मैंने लिया है. काही होणार नाही, शांत डोळे मिटून झोप, रिलॅक्स. ये दिखाई दे रहा है ना? अच्छा, मुंह खोल, मुंह खोल. मुंह खोलना है, आंखें बंद करने को पेशेंट को बोलना है. स्पिरिट स्वाब ने नासाग्र ठीक तरीके से साफ करना है. हमारी करांगुली दाहिने हाथ की सुई मैंने सुई ऐसी पकड़ी है, करांगुली पेशेंट के हनुवटी पर रखनी है. शांत रहा. टोचणार टोचलं तर सांग. या पद्धतीने आधी सुई ठेवली आहे. झालं. ही थोडीशी हल्ली, त्यामुळे माझंही दोनदा टोचावं लागलं, नाहीतर एका प्रिकमध्ये टोचून होतं. शांतपणे पेशंटला एक 6 ते 7 सेकंद सुई ठेवायची आहे, सुई काढायची आहे. आपल्याला व्हिडिओमध्ये दिसत असेल एक थेंबर सुद्धा रक्त आलेलं, सॉरी, आपको दिखाई दे रहा होगा, एक बूंद भी रक्त नहीं निकल रहा. पेशेंट, मैं अभी पेशेंट को कुछ नहीं पूछूंगा, पेशेंट खुद उठाकर बताएगा. उसे अभी इसको शिरशूल नहीं था, लेकिन फिर भी माइंड कितना क्लियर होता है वो ये बताएगी. थोड़ा सा रक्त बाहर काढ़ाने का प्रयत्न करते, थोड़ा सा खून निकालने का प्रयास मैं कर रहा हूं. एक बूंद या 2 बूंद खून जब निकलता है तो बहुत अच्छे से सरदर्द पूरा का पूरा बंद हो जाता है. उठून बस. तुला काही वाटलं असेल रिलॅक्सेशन वगैरे तर ते जाणीवपूर्वक सांग. काही वाटलं नाही असं असेल तरी उठून बस. माईक मांडी घालून बस. 2 मिनटं शांत बस. चक्कर वगैरे येत नाही आहे ना? सबके सामने मुंह करके जो भी लगता है उसे बोल दो. असं फिर सुई टोचण्यापासूनचा अनुभव आणि तुला काय वाटलं ते.
नासाग्र परफॉर्म विद्या कर्मा फर्स्ट टाइम ही की हूँ. इससे पहले कभी किया नहीं था मैंने खुद के ऊपर. तो आफ्टर परफॉर्मिंग विद्या कर्मा इससे पेन तो बिल्कुल भी नहीं होता है. जो सुई का चुभन रहता है उससे दर्द बिल्कुल भी नहीं हुआ है. एंड कामिंग ऑफ माइंड लगा, थोड़ा सा रिलैक्सेशन लगा मुझे. जैसे कि सर ने बोला मुझे हेडेक नहीं था, बट अगर हम पेशेंट के ऊपर परफॉर्म करने के बाद पेशेंट को कैसे रिलीफ मिलता है वो हम ट्राई करके देख सकते हैं. थैंक यू.
ये मोबाइल ये नस्य प्रक्रिया सॉरी नासा विथ ये प्रक्रिया आपने देख ली. हमें 3 कर्म दिखाने हैं. पहला दिखा दिया विद्ध कर्म, अब दूसरा नस्य. असंच झोप. तू जरा सॉक्स काढतोस का? कारण नंतर काय आहे, तळ हाताना तळ पाय पण घासायचे. इथंच काढ, इथंच काढ, बस कशाला. आगे का कर्म है नस्य कर्म. ऊर्ध्व जत्रु विकार, न्यूरोलॉजिकल डिसऑर्डर्स, यही सब्जेक्ट होने के कारण नासा में करने वाले 2 प्रयोग मैं आपके सामने दिखा रहा हूं। अभी कौन सा भी पंचकर्म जो थोड़ा प्रोसीजर वाला होता है उसमें हम स्नेहन स्वेदन करते हैं, वैसे ही नस्य प्रक्रिया करने के लिए हम सिर्फ यहाँ पर थोड़ा सा स्नेहन और स्वेदन करने जा रहे हैं। शांत झोप, 2-2 थेंब टाकते आणि तेल जिरवते, बीच में डाल, इधर इधर इधर, हाँ बस। पहले वो हाँ, मैं डालता हूँ, रब, हाँ पूरा कपाल पर पहले हमने तेल डाला है, वहां स्नेहन और थोड़ा सा मर्दन, लेकिन हल्के हाथों से हम कर रहे हैं। अब उसके बाद ये नासा वाला परिसर, वहां 1 बूंद तेल मैं डाल रहा हूं, अंगूठे से कर रहे, हाँ बस। पूरा ये देख, ऐसा पूरा कर, हाँ वो पूरा ऊपर जाने दो। कॉटन बाहर निकाल। अब यहां स्नेहन हो चुका। अब जो परिसर में हमने तेल लगाया है वहां पर हम हल्का सा स्वेदन करेंगे। ओपीडी में हमारे पास जो भी साधन होता है, थोड़ा सा मैंने अभी यहाँ गर्म पानी लेकर आया हूँ मैं, और वो गर्म पानी में कॉटन ऐसा कॉटन लेते हैं, थोड़ा सा गर्म पानी में अरे निकालो मत, उसी से चलो छोड़ दो, मैं करता हूँ। लगता है ना रे? जहां जहां हमने तेल लगाया है वहां वहां ये गर्म पानी से, कॉटन से हम थोड़ा थोड़ा रब कर रहे हैं। और थोड़ा कॉटन इतना ही दे, इतना ही कॉटन दे। तेल मैं डालू, थोडासा उठ, मी तुझ्या खांद्याखाली उशी देणार आहे, सरक थोड़ा, बस झोप। अब क्या करना है, रुक रुक, यहां से नीचे पिलो रखनी है, यानी मन्या थोड़ी सी ऐसी उल्टी हो जाएंगी। जरा वर ये, वर सरक, जरा वर सरक, सरक इकडे माझ्याकडे ये, बस झोप। तेरे डोक्या खाली हाथ घातलाय, या इस तरह थोड़ा सा मन्या नीचे होनी चाहिए। मुंह खोल, पूरा रिलैक्स रहे। अभी पेशेंट को मुंह खोलना है, पेशेंट का धीरे से सांस लेने को बोलना है। उसके बाद आंख दोनों बंद करने हैं। नासाग्र हमारे अंगुष्ठ से थोड़ा सा पीछे खींचना है वो है. तोंडानं हलका श्वास घेत राहा. अब आगे हम अंगुली से नासा थोड़ा सा दबाएंगे. जोरात श्वास वर घे. ओढ जोरात. आणि एकदा उठून बस. तळ हात एकमेकावर जोरात घास. घास जोरात. गरम हो दे. हाथ एक के एक ऊपर हाथ गरम करने के लिए लगाने हैं. उजव्या हाताने डाव्या पायाचा तळवा घास. अब दाहिने हाथ से बाएं थोड़ा सा मर्दन करना है. बाएं हाथ से दाहिने पैर का घे की जवळ घास. तेल ओढ वर. तेल वर ओढ. ओढ. मांडी घाल. शांत बस 2 मिनिटं. घशात तेल आलं तुझ्या. घशात तेल आलं येते. लागलं तर चूळ भरून ये. आलं नसेल तर नाही म्हण. आलं असेल तर हो म्हण. येते नाही बसू दे. पण घशात तेल आलं का बघूया काय होते. आलं घशात तेल. ज्येष्ठ मताचं आहे. काय काळजी करू नको. खवखवेल थोडं. गुळणी करायची आहे का तुला पाण्याची. नाहीतर पाण्याची गुळणी करून थुंकून टाक. काही नाही ना वाटत त्रास. आता डोकं हलकं झालं का सांग मला. ते सांग. स्माईक दे. कन्नड़ मध्ये बोल. हिंदीत बोल. नस्य करने से लाभ क्या हुआ. जो भी है बोल दे. तुम्हारा ही है ना.
नस्य करने से एक लाभ ये हुआ है कि मेरा पहले सिर जड़ था, मतलब हेवी था. अब थोड़ा हल्का हल्का लग रहा है. और जो ये पार्ट जो था वो पेनफुल रहता था, लेकिन अभी नस्य करने के बाद हल्का हल्का लग रहा है. थैंक यू.
तुला काही त्रास वाटत नाही ना. ना तर बूट मोजे घालून 2 मिनिटं इथं बस. वाटलं तर एक गुळणी करून फुंकून टाक. घशात आलं का. जड वाटू दे. घशात तेल आलं का. हाँ. मैंने इसको पूछा गले में तेल नस्य करने के बाद हम जो ये प्रक्रिया करते हैं आप घर में जाकर खुद पर करो दूसरे पर करो, लेकिन आदर्श नस्य चिकित्सा हो गई तो गले में तेल नहीं आना चाहिए. अभी तक तो नहीं आया है. जो सुविधा यहाँ पर है उसी के हिसाब से मैंने किया है. अले नहीं. चलो अभी तो इसके गले में तेल नहीं उतरा है. ये एक आदर्श नस्य प्रक्रिया है. पंखा बंद करू. तो पंखा नहीं पंखा बंद करू देतो. चलो हम अब क्या. हे तुझा आणि कोणी मित्र अब सभी जगह एक पर एक फ्री मिलता है। सैनिटाइजेशन को जरूरत नहीं था, फिर भी टेबल के लिए उत्सव दे दिया। तो उस एक के ऊपर और एक फ्री पेशेंट मुझे मिला है। अभी इस मैडम आधार पूरा यहाँ तो मैडम को संतुष्ट हो। हमने जो प्रक्रिया की वो एक नंबर समझ में आई है। अभी उनको हम आशा भी कर सुनते हैं वो अपने सामने हम इस लड़की को थोड़ा सा बाहर आ गया।
Stop ಆಗೋದು ನಿದ್ದೆ ಬರೋದಿದೆ ನಂಗೆ ಗಡ್ಡೆ ಕೊಟ್ಟಿದ್ದಾರೆ. पॉइंट भी बढ़ रहा है, पॉइंट भी बढ़ रहा है, पॉइंट भी बढ़ रहा है.
ವೈದ್ಯ ಅವರಿಗೆ ಸನ್ಮಾನ ಕಾರ್ಯಕ್ರಮವನ್ನು ನೆರವೇರಿಸಿಕೊಳ್ಳಲು ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್ ಮಾಟ್ರೆ, ಡಾಕ್ಟರ್ ಎಂ.ಟಿ. ಕರಿಶೆಟ್ಟಿ, ಡಾಕ್ಟರ್ ಶಾಂತಾ ದೀಕ್ಷಿತ್, ಡಾಕ್ಟರ್ ಮಹೇಶ್ವರ್ ಅವರನ್ನು ಕೇಳಿಕೊಳ್ಳುತ್ತೇವೆ. ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ಅತಿಥಿ ಉಪನ್ಯಾಸಕರು ಎಲ್ಲ ವೇದಿಕೆಗೆ ಬರಬೇಕು. ಕಾರ್ಯಕ್ರಮ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ಇದೆ.
saturation is the contrast.
ಏನು
Dear friends, after such an enlightening session, it's time to expand our horizon through a panel discussion. Our esteemed panelists will delve deeper into the topics covered, share their expert perspective, and answer your questions. This is a great opportunity to broaden our understanding and clarify any queries. Please join me in welcoming our panelists to the stage for this interactive session. I would like to hand over the stage to our doctors, Dr. Somsek Hudas and Dr. Siddharth Sangwamsa.
Good evening, everybody. I am Kiran Sanigo. Myself, Ayush Dhara. Good evening, everyone. Right now, we have covered a few sessions of today's seminar and Ayush Dhara, where learn so many things, experience so many things, what to learn about universities, to keep neurological disorders since morning. Now we are with all the speakers, eminent speakers who have given their own experience to all people this morning. Right from morning, each and every station was very much informative, and I think lot of things we can adapt primarily in each and every session. So this today we are having some questions which we can cover in the scientific session. Myself and Dr. Hudas sir will continue this question session. Good evening, sir. So the first question from the audience is that what are the limitations and scopes of electrophoresis in homeopathic practice?
Hello. Yeah, very good evening. So the question is role of electrophoresis in addressing the condition migraine. Generally, for different other than homeopathy, we have centrismal and we have predominantly millismal scale of potency that we use. And from my practical experience, I have got beautiful results with centrismal potency. And millismal potency is something that we are using very recently. And for in acute cases, especially when we have an acute exacerbation of migraine, I have found millismal potency to be very useful. Otherwise, in chronic cases, centimal potency does wonders.
So in acute cases, we should use it.
There is need for frequent repetition. For example, the attack is very severe and simple dose cannot suffice. There, every hour, every half an hour, they have used millismal potency with good results.
Thank you, sir. Thank you for the question.
The second question is related to migraine itself. It is to actually to whether Santosh Professor, as is not here, I request Manas sir to take up this one. Ayurvedic management of migraine. Yes. No.
आयुर्वेद में ऐसे टिपिकल एक व्याधि लिया और उसकी चिकित्सा ऐसा विषय नहीं होता, रूट कॉज तक जाना चाहिए, तभी जाकर वो माइग्रेन क्यों हुआ है। आप आयुर्वेद के स्टूडेंट कितने हैं यहाँ? मूले कुठा रहा, ये जो बोला जाता है और अधोवातस्य रोधेन हमने यदि अपान वायु का अवरोध किया, हम अभी पब्लिक में बैठे हैं, हमने अपान वायु छोड़ना उचित नहीं समझा तो भी सरदर्द हो सकता है। यहाँ से वो माइग्रेन का हम कारण ढूंढेंगे और उसके ऊपर यदि हमने चिकित्सा की तो ही वो लाभदायक सिद्ध हो जाती है, वैसे ही वो अपुनर्भव भी हो जाती है। वैसे तो उसमें दवाइयाँ बहुत सारी दी है, पथ्यादि चूर्ण दिया है, जो शिरशूल के ऊपर ही बताया है। अभी 2 पेशेंट को तो मैंने आपके सामने ही ट्रीटमेंट कर दी। ऐसे पंचकर्म के बहुत सारे उपाय भी हम उसके ऊपर कर सकते हैं।
So much, sir.
My next question again to Vijay Krishna sir. Sir, what is the role of sector remedies and constitutional remedies in migraine, sir? Please.
So the question is role of sector and constitutional treatment in migraine. See, sector is only the presenting thing. We are not going deep into the past history. We are not going deep into his mental, family history and personal history. So what we are seeing in front of us, so there we make a small totality, and that is what we call it as a sector totality. Sometimes in clinics, especially when a migraine patient comes with an acute attack, taking the entire detail history might be difficult. Our main focus is to relieve the patient from his migraine pains or migraine attack. In such situation, we generally go for sector treatment. Once the sector treatment is done, please remember the patient has to be taken care in detail based on the principles laid by Dr. Hahnemann, the founder. The entire history should be taken and it should be definitely followed by a constitutional treatment, sir.
Okay. Thank you, sir. Next, we have a question regarding Grudrasi. Instead of Malar, sir, I will take this question to Dr. Vishwanath, sir. According to Ashrayi Bhava, Vata is the Ashrayi of Asti dosha. Then why is the Grudrati in Grudrasi, the Asti dosha is not vitiated? One thing. Related to that, you told in Samprapti, only Rasa, Rakta, Mamsa Dhatu are vitiated.
This Ashrayi Bhava is told in Ayurveda to understand where the Vata dosha is getting manufactured. Not for the disease. Every time, every disease may not be at the place of Asti, so that every disease may not be treated when there is an involvement of Vata is there, it's indirectly related to Asti. It's a totally a dull-headed approach, the question itself is. One. Second point, simple. Talking itself is a Vata Vriddhi karma, so don't think that Asti has to be treated. First point. Then involvement of Mamsa, Shira Kandra involvement, as it is involved in the Trikasandhi. There are 2 Trikasandhis are there. In that Trikasandhi are explained 2, that is Adha and Urdhva Trika. In both are avalambaka kapha sthanas. That's why this kapha lakshana may come. That's why apatarpana chikitsa is identified starting. Then you shift on kevala vata chikitsa. Every vata is not to be treated on the principles of asti, ashraya. For the betterment, for the shodhana, you all do shodhana future. So whatever vata next is coming for the physiological action, it should be good. That's what the thing. Okay? Thank you, sir.
Thank you. Thank you, sir.
Vijay Krishna sir, why is the topic beyond painkiller relevant for migraine, sir?
So the question is, why is the today's topic beyond painkillers relevant in treating migraine? Conventionally, we saw that the treatment for migraine is mainly painkillers. And as you understand, when a patient is treated only with painkillers, there are 3 possibilities. The first possibility is there is definitely a relief, I don't deny, and the relief is temporary. And the second very important problem is the patient getting addicted to a particular drug. So the drug dependency is also very prominent. And third thing, what you see is the side effects which come because of these drugs. Sir, beyond painkillers for migraine, it becomes very relevant because homeopathy as a system offers treatment beyond a painkiller where the effect is permanent and you have no drug dependency and there are zero side effects when it comes to taking homeopathy for migraine. Thank you, sir.
I'd like to add here my personal experience as a doctor. I had a patient who used to always complain about pain over the right side of the head, and I usually used to say it is a migraine and give some acute drug. But every off and on he was with the same complaints coming to me. And as a homeopath, after taking the proper case taking, after investigations and after repetization, I got a unique symptom from that patient that he was having pain over the right orbital region, that too while staring over the moving objects. So after going over the pathophysiology, I found that it is nothing, not only the migraine, but it is the weakness of the intrinsic muscle, that too of the right side. This was the final diagnosis of the patient. And after going to the repetization, there was only one drug I am saying, weakness of right-sided intrinsic muscle. Gelsimem was the drug which cured that patient forever. This is I'd like to conclude here. Yes, thank you.
Yeah, well, a good interpretation, sir. Thank you for that. Now it's a question to Dr. Sukumari, madam. Any particular yogasana for cancer patients who have got a severe pain? Any such kind of yogasana or any such kind of remedies from your side?
Cancer patient, we can not cure completely, but we can enhance their lifespan by practicing yoga. Same thing, that oxygenation to the brain, and while doing pranayama and each and every asana, we have to do with breathing only, slow inhalation and exhalation. It produces new cells in our body, and cancer cells will be reduced and new cells will be improved. So we can improve their lifespan.
Wow, that's
And
wonderful.
side effects of chemotherapy also will reduce by practicing not only yoga, naturopathy treatments also helpful for them.
Wow, that's what I said in the beginning itself in the morning. It is not an alternative. Ayush system is not an alternative. It is a native system. We have answer for each and every ailments in the society. And now it's a question to Dr. Vasidhar, sir. Can we treat the patient with extradural lesion of a spinal canal in any Ayush system of medicines, aged about 55 years, female patient, complaining of lower backache and lower limb pain since 6 months?
This extradural compressions by external force, maybe a mechanical compression it is. If it is surgically removed, is the best choice of the treatment because it's growing from the extradurally. But the growth is due to epidural or epidermal cyst, which may be possible to resolve by MRI vision. If I go through that, I can give you a comment whether this Granthi Chikitsa can be adopted and it can be treated. It all depends upon the type of the compression done by an extradural mass. Whether the mass is due to the bony part, very difficult. Sometimes some bone or some muscle or some dermoid cyst may penetrate inside. It depends upon the type of the mass because it's not anything internal. It's from extradural mass is putting a pressure on the cord means, and also patient presentation. Whether she is developing a motor deficit, then the emergency surgery may be the choice. If there is no involvement, then we can go ahead for the dissolving of particular cyst. Once the MRI is there, then we can go ahead, sir.
Okay, sir. Is there any role of this Agni Karma in that one?
Role of Agni Karma. This Agni Karma is explained in Ayurveda in a Gridrasi, where there is Antara Kandra Gulfa, you have to do Rakta Mokshana, and Agni Karma is explained. We have done one study in our college, sir. It is a method of reduction of the inflammation biomarker the study has revealed that gridrosy and low backache are high of HSCRP and IL-6 are increasing. So by doing Rakta Mokshana, some amount of we can take off the inflammatory biomarkers, the pain will come down for a time being. Once again, there will be conventional therapy should be adopted. In Agni Karma, there is the acute pain relief, maybe shifting of pain from the another compartment to the next compartment. This may be giving a temporary relief, but the future, the real pathology has not changed. For that, once again, the conventional Ayurveda therapy to be done. This is we are doing now. Now we are doing Agni Karma and we are conducting live nerve conduction study. Yesterday I approved this study for the intervention. Whether this Agni Karma is working through nervous system or some other system. Because so many times what happened, the boy came with a right hand pain. I take a stick and hit him on a left hand. Then I'll ask where the pain is. He'll tell in the left hand. This is what things are happening for a time being. There was acute pain, when to manage, to be frank to tell, some evidence to be created. Because olden days, this sentence was written 5,000 years back, where there was no NSAIDs, no pain relief management. To relieve acute pain, bloodletting therapy was monitored and we did it. There is a good amount of reduction in IL-6 and HSCRP has come down. This may be the one of the probable till date understanding why the pain is coming down. And in Agni Karma, what happened, we did it with IL-6, but it has suddenly spiked to the burn injury. The inflammation has shifted to some other part. That is what I can conclude. These are two theses we completed and are going for a publication. Yes.
Thank you so much, sir.
Sir, next question, Vijay sir. Can homeopathy be used along the side convention medication for any of the disease along with migraine, sir?
So can homeopathy be used?
As a side convention treatment.
Along with
with the side convention.
Yeah. So the question is, can homeopathy be used along with the conventional medicine for migraine? This is a very interesting question because many of the patients directly don't come to a homeopath as a priority. They go to different system of medicine and then as a last option they come to us. So when you have a patient like this who is dependent on a specific therapy, specific system, it is not advisable to stop that therapy and switch over to homeopathy immediately. So what we do is we start our medication and we ask the patient to continue with this medication, and slowly as the improvement is seen, we slowly taper the conventional medicine and we keep the patient only on homeopathic medicine. So to conclude, it is possible that homeopathy can be given along with the conventional medicine.
But is there many questions will arise that there will be drug-to-drug interaction, such
Yes,
kind
sir.
of
Yeah.
questions will be
So one of our friend is also adding, sir, if that is done, is there a possibility of drug-to-drug reaction?
Drug-to-drug interaction or a reaction.
Yeah.
If both therapies are used
Yes, sir.
at the
Yes.
same time.
So it's a nice question, sir. For this, you need to understand the homeopathic philosophy. The medicines that we administer, sir, it's in a very dynamic form and it is in a very minute form, sir. So from what I have seen, at least for last 28 years, there are zero drug reactions which have happened in practice, because the way homeopathic medicines affect is entirely different from the conventional medicines that act on the human body. So they're different. So no chances of drug reaction or drug interaction happening in such cases.
So that's the beauty of homeopathic medicine, that as sir is opening that they act in a different kind of action with a different kind of mode action will be there. There will be no such drug-to-drug interaction will be there. So that we can freely use our conventional medicines along
Yes, sir.
with other system of medicines in management of so many of the diseases, not only in neurological disorders and other diseases also. And now the question is, thank you, sir.
Thank you.
Is there any importance of bowel clearance, that is use of laxative in treatment of gridrosy? In treatment of gridrosy,
गृध्रसी में मलावरोध यदि दिखता है, सिर्फ गृध्रसी में नहीं है, कौन से भी व्याधि हो और मलावरोध ये लक्षण दिखाई देता है, तो मलावरोध का कारण क्या है, वहाँ तक हम जाते हैं और उसकी ट्रीटमेंट करना प्रारंभ कर देते हैं। सिर्फ लैक्सेटिव दिया तो जहाँ रेक्टम में भरा हुआ स्टूल रहता है वो निकल जाता है और कुछ लाभ नहीं होता। वो उसका रूट कॉज क्या है, क्यों मलावस्तंभ हो रहा है, ये देखकर पहले हल्के तो हमें स्नेहन, मृदु, अनुलोमक ये जो ग्रंथों ने बताया है उसी के चलते पेशेंट हमारे पंचकर्म के लिए पूरे तैयार हो गया, तो आगे जाकर हम ड्रास्टिक या परगेटिव ऐसी जो विरेचक चिकित्सा बोली है वो हम कर सकते हैं।
Thank you so much, sir. Next question is for Dr. Sukumari madam. That is there any such kind of remedies, yogasanas or pranayama in a patient, or rather than we cannot call them as a patient, a pregnant lady having a 6 months of pregnancy, 6 months plus pregnancy, pregnancy-induced hypertension is there, and also with the diabetic. Any measurements for their care, antenatal care?
Yeah. Yoga is the very best option for them. For normal delivery also, naturally they can reduce their hypertension, diabetes also. But they have to do properly. Simply watching YouTube and all, they should not do. But in the guidance of qualified, they can reduce all the things for hypertension, thyroid, even thyroid also. So many are suffering from thyroid also. Everything we can reduce by yoga only, if they practice correctly. Without medicine, they can manage.
Okay, thank you.
Sir, last question to Ajay Krishna sir. Sir, is homeopathy suitable for all the age groups in migraine, and are there any side effects or risks with homeopathy in migraine in pediatric cases?
Yeah. So this is a common question generally public asks. Sir, do you have any side effects, and how safe is homeopathic medications, and can homeopathy be given to all age groups is a common question that comes up. This being a last question, I'll just take a minute extra. See, all the Ayush systems are 5.5 years full-fledged course, and we have a 3-year MD, and of course we also have PhDs and lot of specialization. Sir, if you are consulting a qualified homeopath, the question of side effects, the question of other effects are least. Absolutely no side effects. That's one question. And homeopathy is equally safe for all the age groups. We have 1 month, 2 months till 85 plus patients, aged patients that we have been treating. And there are a lot of seniors who have been treating without absolutely any side effects. So on this podium, I would like to again emphasize that please consult a qualified homeopath, and rest assured you will be in the safe hand and there will be absolutely no side effects because of this particular system.
Thank you very much, sir. Thanks a lot, sir. Any more questions from the audience again?
From the audience? Any questions from the audience? Okay, hope this is going to be a wonderful today. That since morning you have learnt everything, every skills from eminent speakers and practical demonstration also. No question means you have understood everything. Yes, that is a success of this seminar. What I can say is a big round of applause to all the eminent speakers who have taken all the pain to teach you, come over from all the ways from their native places. And we from the Ayush Dhara, we thank each and every speakers rendering their service today and making us very skillful and eminent practitioners in future days.
We are really thankful to all the speakers for a wonderful presentation. It will definitely add much more knowledge to all the delegates today. Thanks a lot. Thank you very much. Yes.
Conclusion?
Thank you.
One photo, please.
Namaskar.
Please. Sir, one photo. So with this, we can say that today we have planned to bring out one booklet after the completion of this seminar. All the eminent speakers, whatever the inputs they have given since morning, and all the questionnaires discussed so far will be put into writing, and one booklet will be released. I hope, I request all the organizers to reach that booklet to all the delegates. To all the delegates. That is my humble request to the organizers from the jury of panel discussion doctors.
I request all the delegates to give your feedback, as we have kept the box at the entrance. So you please give your feedback regarding today's seminar. Thanks a lot.
Thank you so much, sir.
Thank you, sir. Mandar, sir. Now, we have come to the valedictory function of this great Ayush Dhara conference, Flow of Knowledge. That is now closing ceremony of this Ayush Dhara conference, Flow of Knowledge, which featured wonderful scientific sessions, excellent speeches, outstanding speakers, and a day full of knowledge and inspiration. Now, I request all the speakers to come on the stage. Kindly, speakers. All our speakers, kindly come on the stage. Jabbar ne bola.
सेरेमोनियल फंक्शन यारिದ್ರು ಅವರಷ್ಟೇ
और अष्ट कर रही कौन
आगे अभी आ गए स्पीकर्स
ದಯವಿಟ್ಟು ಕ್ಷಮಿಸಿ.
Now this session will be conducted by Dr. Prabhakar Mandre sir.
ಸಮಾರೋಪ ಸಮಾರಂಭ ಕಾರ್ಯಕ್ರಮವನ್ನು ನಡೆಸಿಕೊಡಲು ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್ ಮಾಂಡ್ರೆರವರನ್ನು ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ. ಮುಖ್ಯ ಅತಿಥಿಗಳನ್ನು ಬರಮಾಡಿಕೊಳ್ಳುವುದು ಮುಖ್ಯ ಅತಿಥಿಗಳಾದಂತಹ ಡಾಕ್ಟರ್ ಮೋಹನ್ ಬಿರಾದರ್ ಸರ್, ಶ್ರೀಯುತ ಹರೀಶ್ ಆರ್, ದಯವಿಟ್ಟು ವೇದಿಕೆಯನ್ನು ಅಲಂಕರಿಸಬೇಕೆಂದು ಕೋರಿಕೆ. ಡಾಕ್ಟರ್ ಮೋಹನ್ ಬಿರಾದಾರ್ ಸರ್, ಶ್ರೀಯುತ ಹರೀಶ್ ಆರ್, ಉಪಾಧ್ಯಕ್ಷರು ಆಯುಷ್ ಟಿವಿ, ದಯವಿಟ್ಟು ವೇದಿಕೆಗೆ ಬರಬೇಕು. ಅಧ್ಯಕ್ಷರು ಡಾಕ್ಟರ್ ಅಮಿತ್ MS ಸರ್, ಅತಿಥಿಗಳಾದಂತಹ ಡಾಕ್ಟರ್ ಶ್ರೀಕಾಂತ್ ಕೊಂಕಣಿ, ಡಾಕ್ಟರ್ ಸೋಮಶೇಖರ್ ಹುದ್ದಾರ್, ಡಾಕ್ಟರ್ ರವೀಂದ್ರ ವಾಯ್, ಡಾಕ್ಟರ್ BS ಗೌಡಪ್ಪ ಗೌಡರ್, ಡಾಕ್ಟರ್ ಸುನಿಲ್ ಕುಮಾರ್ ಸಿದ್ದಾಪುರ್, ದಯವಿಟ್ಟು ಇವರೆಲ್ಲ ವೇದಿಕೆಯನ್ನು ಅಲಂಕರಿಸಬೇಕೆಂದು ಕೋರಿಕೆ. ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮವನ್ನು ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್ ಮಾಂಡ್ರೆ ಸರ್ ಅವರು ನೆರವೇರಿಸಬೇಕೆಂದು ವಿನಂತಿ.
ಶುಭ ಸಂಜೆ. ಹಲೋ ಎವ್ರಿವನ್, ಹಲೋ. ಇದ್ದವರಲ್ಲಿ ಕದ್ದವ್ರು ಯಾರು ಅನ್ನೋಂಗೆ ನಿಮ್ಮದು ಧ್ವನಿಯನ್ನು ಕಡಿಮೆ ಮಾಡಬೇಡ್ರಿ. ಎಷ್ಟು ಜನ ಇದ್ದೀರಿ ಅವರಷ್ಟೇ ಜನ ಸ್ವಲ್ಪ ಲೌಡ್ಲಿಯಾಗಿ ಬರಲಿ. ಹಲೋ, ವೆರಿ ಗುಡ್. ಇನ್ನೊಂದು ಸಾರಿ ಹಲೋ. ಥ್ಯಾಂಕ್ ಯು. ಬೆಳಗ್ಗೆನಿಂದ ಸಾಯಂಕಾಲದವರೆಗೆ ಒಳ್ಳೆ ಟಿಫಿನ್ನು, ಒಳ್ಳೆ ಊಟ ಮತ್ತು ಜ್ಞಾನಾರ್ಜನೆ ಆಗಿದೆ ಅಂತ
ನಾನು ಭಾವಿಸುತ್ತೇನೆ. ಈಗ ಕೊನೆಯ ಹಂತ ಮುಕ್ತಾಯ ಸಮಾರಂಭ. ಈ ಮುಕ್ತಾಯ ಸಮಾರಂಭದಲ್ಲಿ ನಮ್ಮ ರಾಜ್ಯ AFIನ ಅಧ್ಯಕ್ಷರಾದಂಥ ಮೋಹನ್ ಬಿರಾದರ್ ಅವರು ಉಪಸ್ಥಿತರಿದ್ದಾರೆ. ಅದರ ಜೊತೆಗೆ ನಮ್ಮ ಉತ್ಸಾಹಿ ಚಿಲುಮೆ ಮತ್ತು ಇನ್ನೊಂದೇನು ಹೇಳ್ತಾರೆ ಅಂದರೆ ಒಂಥರದ ಮನೋಶಾಸ್ತ್ರಜ್ಞರಾದಂಥ ಶ್ರೀಯುತ ಹರೀಶ್ ಸರ್ ಅವರು ಆಯುಷ್ ಟಿವಿಯ ಉಪಾಧ್ಯಕ್ಷರು, ಅವರು ಕೂಡ ನಮ್ಮ ವೇದಿಕೆ ಮೇಲಿದ್ದಾರೆ. ಅದರ ಜೊತೆಗೆ ನಮ್ಮ ಯಂಗ್ ಚಾರ್ಮಿಂಗ್ ಹಸನ್ಮುಖಿ, ಎಲ್ಲರ ಪ್ರೀತಿಯ ಪಾತ್ರ ಅಂತ ಖನ್ನಾ, ಲಾಲ್ಲಾ, ಅಮಿತ್ MS ಅವರು ವೇದಿಕೆ ಮೇಲಿದ್ದಾರೆ. ಈ ಕಾನ್ಫರೆನ್ಸಿನ ಉಪಾಧ್ಯಕ್ಷರು ಡಾಕ್ಟರ್ BS ಗೌಡಪ್ಪ ಗೌಡವರು ಕೂಡ ವೇದಿಕೆ ಮೇಲಿದ್ದಾರೆ. ನಮ್ಮ ಧಾರವಾಡ ಜಿಲ್ಲೆಯ ಅಧ್ಯಕ್ಷರಾದಂಥ ಡಾಕ್ಟರ್ ರವೀಂದ್ರ ವಾಯ್ ಅವರು ಕೂಡ ಈ ವೇದಿಕೆ ಮೇಲೆ ಉಪಸ್ಥಿತರಿದ್ದಾರೆ. ಲಾಸ್ಟ್ ಬಟ್ ನಾಟ್ ಲೀಸ್ಟ್, ಎಲ್ಲರಿಗಿಂತ ಕಿರಿಯ, ಕೆಲಸದಲ್ಲಿ ಹಿರಿಯ ನಮ್ಮ ಯುವ ಕಣ್ಮಣಿ ಡಾಕ್ಟರ್ ಸುನೀಲ್ ಕುಮಾರ್ ಸಿದ್ದಾಪುರ ಅವರು ಕೂಡ ನಮ್ಮ ವೇದಿಕೆ ಮೇಲಿದ್ದಾರೆ. ಎಲ್ಲರಿಗೂ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. ಅನ್ಯತೆ ಭಾವಿಸಬಾರ್ದು. ಅವ್ರದ್ದೊಂದು ಸ್ವಲ್ಪ ಬೇರೆ ಹೇಳಬೇಕಂತ ಮಾಡಿದ್ದೆ, ಎಲ್ಲರೂ ಅವಸರ ಮಾಡಿದರೆ ಇರಲಿ. ಕವಿ, ಸಾಹಿತಿ ಅಷ್ಟೇ ಅಲ್ಲದೆ ನನ್ನ ಅಳಿಯ, ಧಾರವಾಡದಲ್ಲ ಕರ್ನಾಟಕ ರಾಜ್ಯಾದ್ಯಂತ ಎಲ್ಲರ ಕಣ್ಮಣಿಯಾದಂಥ ನಮ್ಮ ಪ್ರಧಾನ ಕಾರ್ಯದರ್ಶಿಗಳು ಡಾಕ್ಟರ್ ಸೋಮಶೇಖರ್ ಹುದ್ದಾರ್ ಅವರು ಕೂಡ ಈ ವೇದಿಕೆ ಮೇಲಿದ್ದಾರೆ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮುಖ್ಯ ಅತಿಥಿಯಾಗಿದ್ದಂಥ ಡಾಕ್ಟರ್ ಹರೀಶ್ ಅವರ ಒಂದು ಮನಸ್ಸಿಗೆ ತಟ್ಟುವಂಥದ್ದು, ನೀವು ಗ್ಲೋಬಲ್ ಫಂಕ್ಷನಲ್ಲಿ ಬಂದಾಗ ನೀವು ನೋಡಿರ್ಬೋದು, ಅವರು ಮಾತಾಡಿರೋದು ನಮ್ಮ AFIನ ಅಷ್ಟೇ ಅಲ್ಲ, ಆಯುಷ್ ಡಾಕ್ಟರ್ಗಳನ್ನ ಯಾವ ರೀತಿಯಾಗಿ ಸರ್ಕಾರದ ಅಂತಂದರೆ ನಮ್ಮ ಆರೋಗ್ಯ ಸಚಿವರ ಎದುರಿಗೆ ನಮ್ಮನ್ನು ಎತ್ತಿ ಹಿಡಿದು ನಮ್ಮ ಪರವಾಗಿ ತಮ್ಮ ಧ್ವನಿ ಎತ್ತಿ ಆಯುಷ್ ಟಿವಿಯಿಂದ ನಮ್ಮ ಸಲುವಾಗಿ ಶ್ರಮಿಸುತ್ತಿರುವಂಥ ನಮ್ಮ ಹರೀಶ್ ಸರ್ ಅವರು ಈಗ ಒಂದೆರಡು ಮಾತುಗಳನ್ನು ಮಾತಾಡಬೇಕಂತೇಳಿ ಅವರಲ್ಲಿ ಕೇಳ್ಕೊತಾ ಇದ್ದೀನಿ. ಅದಕ್ಕಿಂತ ಮುನ್ನ ಅವರ ಪರಿಚಯ, ಡಾಕ್ಟರ್ ಹರೀಶ್ ಅವರ ಪರಿಚಯವನ್ನು ಬಾಯಲ್ಲಿ ಹೇಳೋದಕ್ಕಾಗೋದಿಲ್ಲ, ಅದನ್ನು ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾರೆ. ಹಲೋ, ಈ ಎಲ್ಲ ವಿಷಯಗಳನ್ನು ನೀವು ಕ್ಲಿಪ್ಸಲ್ಲಿ ನೋಡಿದ್ದನ್ನು ನಾವು ಬಾಯಲ್ಲಿ ಹೇಳಿದರೆ ಆಗೋದಲ್ಲ. ಇನ್ನೂ ಅವ್ರದ್ದು ಜಾಸ್ತಿ ಇದೆ. ಅವರು ಸಂಕ್ಷಿಪ್ತವಾಗಿ ಬ್ರೀಫಾಗಿ ಮಾಡ್ಕೊಂಡು ಬಂದಿದ್ದಾರೆ ಸರು. ಈಗ ಅವರಿಂದ ನಮ್ಮ ಆಯುಷ್ ವೈದ್ಯರು ಮತ್ತು ಆಯುಷ್ ವಿದ್ಯಾರ್ಥಿಗಳ ಕುರಿತು ಆಯುಷ್ಯದ ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಯಾವ ರೀತಿ ಆಯುಷ್ಯ TV ಮತ್ತು ಆಯುಷ್ ಫೆಡರೇಷನ್ ಆಫ್ ಇಂಡಿಯಾ ಯಾವ ರೀತಿ ಬೆಳ್ಕೊಂಡು ಹೋಗಬೇಕು, ಯಾವ ರೀತಿ ನಾವು ಅವ್ರ ಜೊತೆಗೆ ಬೆಳಿಬೇಕು ಅನ್ನೋದನ್ನು ತಮ್ಮ ಒಂದು ಮಾರ್ಮಿಕವಾದಂಥ ಮಾತುಗಳಲ್ಲಿ ನಮ್ಮ ಮುಂದೆ ಇಡಲಿದ್ದಾರೆ. ಪ್ಲೀಸ್ ಸರ್.
A very happy evening. Greetings from Ayush TV. ಕ್ರೌಡ್ ತುಂಬ ಕಮ್ಮಿ ಇದೆ, ಬಟ್ ಏನು ಖುಷಿ ಅಂದರೆ ಯಂಗ್ಸ್ಟರ್ಸ್ ಇದ್ದಾರೆ, ದ ಫ್ಯೂಚರ್ ಆಫ್ ಆಯುಷ್. ಜೋರ ಚಪ್ಪಾಲೆ ನಿಮಗೊಂದು, ಜೋರಾಗೆ ನೋಡಿ. ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಮ್ಯಾನೇಜ್ ಮಾಡೋದಿದೆಲ್ಲ ಟಫೆಸ್ಟ್ ಜಾಬು. ಏನು ಇವತ್ತು AFI ಧಾರವಾಡ ನಮ್ಮ ಡಾಕ್ಟರ್ ಅಮಿತ್ ಅವರು, ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್, ಎಂಟೈರ್ ಟೀಮ್ ಅವರು ಮಾಡಿರುವಂಥ ಈ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್, ಆ ಶ್ರಮ ಏನಿದೆ ಅದಕ್ಕೊಂದು ಜೋರಾದ ಚಪ್ಪಾಳೆ ಎಲ್ಲರ ಮುಖಾಂತರ. ಅವರು ಪ್ಲ್ಯಾನ್ ಮಾಡಿದಿರೋ ಗೊತ್ತಿಲ್ಲದೆ ಮಾಡಿದಿರೋ ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ಏನು ವಿಶೇಷತೆ ಇವತ್ತು ಅಂದರೆ, ಇವತ್ತು ಆಯುಷ್ ಅಂದರೆ ಒಂದು ಲಯನ್ ಹಂಗಿರೋದು AFI. ಇವತ್ತು ವರ್ಲ್ಡ್ ಲಯನ್ಸ್ ಡೇ. ಪ್ಲ್ಯಾಂಡೋ ಅನ್ಪ್ಲ್ಯಾಂಡೋ ಗೊತ್ತಿಲ್ಲ, ಆಗಿದೆ. ಯಾವುದೇ ಒಂದು ಗೌರ್ಮೆಂಟಿನ ಕಾನ್ಫರೆನ್ಸ್ ಆಗಲಿ, ಸೆಮಿನಾರ್ ಆಗಲಿ, AFI ಏನಾದ್ರು ಕೈ ಜೋಡಿಸಿಲ್ಲ ಅಂದರೆ ಅದು ಅಟ್ಟರ್ ಫೇಲ್ಯೂರ್ ಆಗ್ಬಿಡುತ್ತೆ. ದಟ್ ಈಸ್ ದಿ ಪವರ್ ಆಫ್ AFI. ದೇ ಆರ್ ದಿ ಲಯನ್ಸ್. ಮತ್ತೊಂದು ಚಪ್ಪಲ್ ಜೋರಾಗೆ ಫೈರ್ ಬೇಕು. ಇನ್ನೊಂದು ದುಃಖದ ವಿಚಾರ, ಹೋದ ವರ್ಷ ಆಗಸ್ಟ್ 9 ಕೋಲ್ಕತ್ತಾದಲ್ಲಿ ಒಂದು ಹೆಣ್ಣುಮಗಳು, 31 ವರ್ಷದ ಹೆಣ್ಣುಮಗಳು, ನಿಮ್ಗೆ ಗೊತ್ತಿರಬೇಕು, ಒಂದು ದುರಂತ ಆಗೋಯ್ತು. ಆಗಬಾರ್ದಿತ್ತು, ಆಗೋಗ್ಬಿಡ್ತು. ಅದಾದಂಥ ಇಂಪ್ಯಾಕ್ಟ್ ಒಂದು ಡಾಕ್ಟರ್ಗೆ, ಡಾಕ್ಟರ್ಸಿನ ತಾಕತ್ತು ತೋರಿಸಿದ್ದು ಹೋದ ವರ್ಷ ಆಗಸ್ಟ್ 17 10 ಲಕ್ಷ ಜನ ಸೇರ್ಬಿಟ್ಟು ನಮ್ಮ ತಾಕತ್ತೇನು ಅಂತ ತೋರಿಸಿದ್ರು. ದಟ್ ಈಸ್ ದಿ ಪವರ್ ಆಫ್ ದಿ ಡಾಕ್ಟರ್ಸ್. ಬಟ್ ತಪ್ಪು ತಿಳ್ಕೊಬೇಡ, ಇದು ನನ್ನ ಕುಟುಂಬ, ಇದು ಓಪನ್ ಆಗಿ ಮಾತಾಡ್ತೀನಿ ನಾನು. ನಮ್ಮ ಆಯುಷಲ್ಲಿ ಆ ಯೂನಿಟಿ ಲ್ಯಾಕಿಂಗ್ ಇದೆ. ಆಯುಷ್ ಸಿಸ್ಟಮ್ ಗ್ರೇಟು, ಬಟ್ ಆಯುಷ್ ಡಾಕ್ಟರ್ಸ್ ಗ್ರೇಟ್ ಆಗಬೇಕು. ಅದು ಆಗಬೇಕು ಅಂದರೆ ಯೂನಿಟಿ ಮಸ್ಟ್ ಅಂಡ್ ಶುಡ್. ನಮ್ಮ ಗ್ಲೋಬಲ್ ವೆಲ್ಬೀಯಿಂಗ್ ಕಾನ್ಫ್ಲುಯೆನ್ಸು ಏನಾರೋ ಸಕ್ಸಸ್ ಆಗಿದೆ ಅಂದರೆ ಅದಕ್ಕೆ ಮೂಲ ಕಾರಣ AFI, ಅದರ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಮೋಹನ್ ಬಿರಾದರ್, ಉದ್ದಾರ್ ಅವರು, ಮತ್ತು ಎಂಟೈರ್ AFI ಟೀಮು, ನಮ್ಮ ಡಾಕ್ಟರ್ ಗುರುಕುಂಬಾರು, ಎಲ್ಲರ ಶ್ರಮ ಅದು. ಬಟ್ ಆಗಲೂ ಕೂಡ ನಾನೊಂದು ಮಾತು ಹೇಳ್ತೀನಿ, ರಿಯಲ್ ಆಗಿ ಸಕ್ಸಸ್ ಆಗಿಲ್ಲ. ನಾವು ಟಾರ್ಗೆಟ್ ಹಾಕೊಂಡಿದ್ದು 10,000 ಜನ ಸೇರಿಸ್ಬೇಕು ಅಂತ ಪ್ಯಾಲೇಸ್ ಗ್ರೌಂಡಲ್ಲಿ. 10,000 ಜನ ಸೇರಿಬಿಟ್ಟಿದ್ರೆ ನಮ್ಗಿವತ್ತು ರಾಯಚೂರಲ್ಲಿ ಘಟನೆ ಆಗ್ತಿದ್ದಿಲ್ಲ. ಎಲ್ಲೂ ನಮ್ದು ಆಯುಷ್ ಡಾಕ್ಟರ್ಸ್ ಮುಟ್ಬೇಕು ಅಂದರೆ 1000 ಸಲ ಯೋಚನೆ ಮಾಡಬೇಕಿತ್ತು. ದುರಂತ ಏನು ಗೊತ್ತಾ, ನಮ್ಮಲ್ಲಿ ಒಗ್ಗಟ್ಟಿಲ್ಲ. ಯಂಗ್ಸ್ಟರ್ಸ್, ನೌ ಯು ಆರ್ ಡಿಸ್ಕಸಿಂಗ್, ಬಟ್ ಐ ವಿಲ್ ಟೆಲ್ ಯು ದ ಫ್ಯೂಚರ್ ವಿಲ್ ಬಿ ವೆರಿ ಚಾಲೆಂಜಿಂಗ್ ಇಫ್ ಯು ಡು ನಾಟ್ ವೇಕ್ ಅಪ್ ನೌ. The reason is Ayush is very powerful system. ಈಗ ತನ ಎಲ್ಲ ಟ್ರಮೆಂಡಸ್ ಇಂಟೆಲೆಕ್ಚುಯಲ್ ಪರ್ಸನ್ಸ್ಗಳು ರಿವೀಲ್ ಮಾಡಿದ್ರು ನಮ್ಮ ಸಿಸ್ಟಮಲ್ಲಿ ಏನು ತಾಕತ್ತಿದೆ ಅಂತ. ಬಟ್ 4 ಗೋಡೆ ಮುದ್ದೆ ಆಗಬಾರ್ದು, ಅದು ಹೊರಗಡೆ ಆಗಬೇಕು ಅಂದರೆ ನಮ್ಮ ಸೌಂಡು ಎಕೋ ಹಂಗಿರಬೇಕು. ನೋಡಿ, 2000 ಅಣ್ಣಾ ಹಜಾರೆ ಮೂವ್ಮೆಂಟು, ಲೋಕ್ಪಾಲ್ ಎಂಥ ಒಂದು ದೊಡ್ಡ ರೆವಲ್ಯೂಷನ್ ಆಯಿತು. ಪಬ್ಲಿಕ್ಕು ಮನ್ಸು ಮಾಡಿದ್ರೆ ಏನೇನು ಚೇಂಜ್ ಮಾಡೋದು ಲಾ ಅನ್ನೋದಕ್ಕೆ ಅದೊಂದು ಉದಾಹರಣೆ. ಎರಡನೇದು ನಿರ್ಭಯ ಕೇಸು, ರೇಪ್ ಲಾನ ಹೆಂಗ್ ಚೇಂಜ್ ಆಯಿತು ಅನ್ನೋದು ಎರಡನೇ ಉದಾಹರಣೆ. ಫಾರ್ಮರ್ಸ್ದು ಅದು 3ನೇ ಉದಾಹರಣೆ. ಯೂನಿಟಿಲಿ ಅಷ್ಟು ಬಲ ಇದೆ. ನಿಮ್ಗೆಲ್ರಿಗೂ ಏನು ರಿಕ್ವೆಸ್ಟ್ ಮಾಡ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ ಅಂದರೆ, ಆಯುಷ್ ಟಿವಿ ಅಂತ ಡೆಡಿಕೇಟೆಡ್ ಚಾನಲ್ ಇದೆ. ಇವತ್ತು ನಾನು ಇಲ್ಲಿ ಬರಬೇಕು ಅಂದರೆ ಐ ವಿಲ್ ಟೆಲ್ ಯು ಒನ್ ಥಿಂಗ್, ಬಿಕಾಸ್ ಆಫ್ ದಿ ಸಪೋರ್ಟ್ ಆಫ್ ದಿ AFI ಆ್ಯಂಡ್ ಕಾನ್ಸ್ಟೆಂಟ್ ಆಗಿ ನಂಗೆ ಟಚ್ಚಲ್ಲಿದ್ದೆ, ಬನ್ನಿ ಬನ್ನಿ ಅಂತ ಕೂಗ್ತಾ ಇದ್ರು ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್ ಅವರು. ಬಟ್ ಇಮೋಷನಲ್ಲಿ ಬರಲೇಬೇಕು ಅಂತ ನನಗೆ ಒತ್ತಾಯ ಮಾಡಿದ್ದು ಡಾಕ್ಟರ್ ಮೋಹನ್ ಬಿರಾದರ್ ಅವರು, ಲಾಕ್ ಮಾಡಿದ್ದು ನಮ್ಮ ಡಾಕ್ಟರ್ ಗುರುಕುಮಾರ್ ಅವರು. ಒಂದು ಸ್ಯಾಟಲೈಟ್ ಚಾನೆಲ್ ಒಂದು ರಿಲೇ ಮಾಡಬೇಕಂದ್ರೆ ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಆಗುತ್ತೆ. ಇಟ್ಸ್ ನಾಟ್ ಎ ಈಸಿ ಟಾಸ್ಕ್ ಟು ರನ್ ದಿ ಶೋ. ಇವತ್ತು ನಾವು ಬಂದು ನಾವು ರೆಕಾರ್ಡ್ ಮಾಡಿ ಎಲ್ಲನೂ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ತಪ್ಪು ತಿಳ್ಕೊಬೇಡಿ, ನಿಮಗೋಸ್ಕರ ನಾವು ನಿಂತಿದ್ದೀವಿ, ನಮಗೋಸ್ಕರ ನೀವು ನಿಲ್ಬೇಕು. ಒಂದು ಲೋಗೋ ಇಲ್ಲ ನಮ್ದು ಆಯುಷ್ ಟಿವಿದು. ಆಯುಷ್ ಟಿವಿದು ಪ್ರೆಸ್ಸಲ್ಲಿ ಒಂದು ನಮ್ದು ವಿಚಾರ ಬಂದಿಲ್ಲ, ಬಟ್ ನಾವು ನಿಮಗೋಸ್ಕರ ಧ್ವನಿಯಾಗಿದ್ದೀವಿ. ನಾನು ಬರಬೇಕು ಅಂತ ಕಾರಣ AFI ನಿಮ್ಮ ಟೀಮ್ಗೋಸ್ಕರ, ಇಲ್ಲಾಂದ್ರೆ ನಾವು ಬರ್ತಿದ್ದಿಲ್ಲ. ಇವತ್ತೊಂದು ವಿಚಾರ ಹೇಳ್ತೀನಿ, ಇಂಟಿಗ್ರೇಷನ್ ವಿಷಯವಾಗಿ ಎಷ್ಟು ವರ್ಕ್ ಮಾಡ್ತಿದ್ವಿ ನಮಗೆ ಡಾಕ್ಟರ್ ಮೋಹನ್ ಬಿರಾದರ್ ನಿಮ್ಮ ಅಧ್ಯಕ್ಷರು ಗೊತ್ತು, ಗುರುಕುಮಾರ್ ಅವ್ರಿಗೆ ಗೊತ್ತು, ಉದ್ದಾರ್ ಅವ್ರಿಗೆ ಗೊತ್ತು. ತುಂಬ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ವಿ ಬ್ಯಾಕ್ ಎಂಡಲ್ಲಿ. ಫ್ರಂಟ್ ಎಂಡ್ ಬಂದ್ಬಿಟ್ಟು ಸುಮ್ಮನೆ ಸೌಂಡ್ ಮಾಡಲ್ಲ ನಾವು ರಿಸಲ್ಟಲ್ಲಿ ಸೌಂಡ್ ಮಾಡ್ತೀವಿ. ಅದು GWC ತೋರಿಸಿದ್ವಿ. ಎಲ್ರಿಗೂ ರಿಕ್ವೆಸ್ಟು, ದಯಮಾಡಿ ಕೈ ಮುಗಿತೀನಿ, ಪಾಸ್ಟ್ ಇಸ್ ಪಾಸ್ಟ್. 2026 GWC ಬರೋ ಮುಂಚೆ ನಾವು ಆಯುಷ್ ಡಾಕ್ಟರ್ಸ್ ಏನು ಅನ್ನೋದು ಮೂಲೆಯಲ್ಲೂ ಗೊತ್ತಾಗಬೇಕು. ನಮ್ಮನ್ನು ಯಾರು ಟಚ್ ಮಾಡಬಾರ್ದು. ಟಚ್ ಮಾಡಬೇಕು ಅಂದರೆ ಅವರು 1000 ಸಲ ಯೋಚನೆ ಮಾಡಬೇಕು. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಒಂದು ಅದ್ಭುತವಾದಂಥ ಪ್ರಾಜೆಕ್ಟ್ನ ತಗೊಂಬಂದಿದ್ದೀವಿ. ಇವತ್ತು ವರ್ಲ್ಡ್ಸ್ ಲಯನ್ಸ್ ಡೇ, ಲಯನ್ ಆಗಿರುವಂಥ AFI ಅವ್ರ ಮುಂದೆ ಇವತ್ತು ಅಫಿಷಿಯಲ್ ಆಗಿ ಲಾಂಚ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಇದು ಸಕ್ಸಸ್ ಆಗಬೇಕು ಅಂದರೆ ನಿಮ್ಗಳ ಯುನೈಟೆಡ್ ಆಗಿ ಸಪೋರ್ಟ್ ಬೇಕು. ಒಟ್ಟಿಗೆ ಎಲ್ಲರೂ ನಿಂತ್ಕೊಳ್ಳಿ. ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ನಾನು ಇವತ್ತು ಮಾತು ಕೊಡ್ತಾ ಇದ್ದೀನಿ, ಏನೇ ನಿಮ್ಮ ಸಮಸ್ಯೆಗಳಿದೆ ಅದಕ್ಕೆ ಆಯುಷ್ ಟಿವಿ ಸ್ಟ್ರಾಂಗ್ ಆಗಿ ನಿಂತ್ಕೊಂಡು ಬದ್ಧವಾಗಿರುತ್ತೆ. ಬಟ್ ನಿಮ್ಮ ಸಪೋರ್ಟ್ ಇಲ್ಲ ಅಂದರೆ ನಾವು ಏನೂ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ನಮ್ಮ GWC ಆದಮೇಲೆ ನಾವು ಏನವತ್ತಲ್ಲಿ ಮಾತು ಕೊಟ್ಟಿದ್ವಿ, ಇಮ್ಯೂನ್ ವೆಲ್ಬೀಯಿಂಗ್ ಮೂವ್ಮೆಂಟು, ಅದರ ವಿಚಾರವಾಗಿ ಆಯುಷ್ ಫೋರ್ಸ್ ಅಂತ ನಾವು ಇವತ್ತು ಲಾಂಚ್ ಮಾಡ್ತೇವೆ. ದಯಮಾಡಿ ಅದೊಂದು AV ಒಂಚೂರು ಹಾಕಬೇಕು. ದಯಮಾಡಿ AV ಇದೆ ಒಂದು ಹಾಕಿ, ಆಯುಷ್ ಫೋರ್ಸ್ ಅಂತ. ಅಫಿಷಿಯಲ್ ಆಗಿ ಇವತ್ತು ಯೂಟ್ಯೂಬಲ್ಲಿ ಲಾಂಚ್ ಆಗಿದೆ. ಅಲ್ಲಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ನಂಬರ್ ಬರುತ್ತೆ. ಅಲ್ಲಿ ದಯಮಾಡಿ ಈಗಲೇ ಸ್ಪಾಟಲ್ಲಿ ನೀವು ನಿಮ್ಮ ಹೆಸರು ಮತ್ತು ನಂಬರ್ನ ನೀವು ಅಲ್ಲಿ ಮೆಸೇಜ್ ಮಾಡಿ ಅಥವಾ ನಿಮ್ಮ ಕಾಮೆಂಟ್ಸಲ್ಲಿ ಹಾಕ್ಬೋದು. ಆಮೇಲೆ ನಮ್ಮ ವೆಬ್ಸೈಟಲ್ಲೂ ನೆಕ್ಸ್ಟ್ ವೀಕ್ ಲಾಂಚ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಆಯುಷ್ ಫೋರ್ಸಲ್ಲಿ ಕೇಳಿಸ್ಕೊಳ್ಳಿ ಎಲ್ಲರೂ ದಯಮಾಡಿ, ಯಾಕಂದರೆ ಡಾಕ್ಟರ್ಸ್ ಕಮ್ಮಿ ಇದ್ದೀರಾ. ಯಾರ್ಯಾರು ಎನ್ರೋಲ್ ಆಗ್ತಾರೆ ಕಂಪ್ಲೀಟಾಗಿ ಉಚಿತ. AFI ಅವ್ರದ್ದು ಆಯುಷ್ ಫೋರ್ಸ್ ಅದು. ಈ ಇದರಲ್ಲಿ ಪ್ರತಿಯೊಂದು ಡಿಸ್ಟ್ರಿಕ್ಟು ಟೌನಲ್ಲೂ ನಾವು ಬಂದ್ಬಿಟ್ಟು ನಮ್ಮ ಆಯುಷ್ ಡಾಕ್ಟರ್ಸ್ನ ಪ್ರಮೋಟ್ ಮಾಡ್ತೀವಿ. ಒಂದು ದೊಡ್ಡ ಯಾತ್ರಾ ನಡೆಯುತ್ತೆ. ದಯಮಾಡಿ ನಿಮ್ಮ ಯೂನಿಟಿ ನಮ್ಗೆ ಬೇಕಾಗಿದೆ, ಒಂದು ಫೋರ್ಸ್ ಆಗಬೇಕು. ಬಿಕಾಸ್ ವಿ ಹ್ಯಾವ್ ಟು ಚೇಂಜ್ ದಿ ಪಾಲಿಸಿ ಆ್ಯಂಡ್ ರೂಲ್ಸ್ ಆ್ಯಂಡ್ ಮೇಕ್ ಇಟ್ ಫೇವರಬಲ್ ಫಾರ್ ಅಸ್. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಇದು ಮಾಡ್ತಾ ಇರೋದು. ಎಲ್ಲರೂ ಮಾಡ್ತೀರಾ? ಜೋರಾಗೆಲ್ಲ ಮಾಡ್ತೀರಾ? ನೋಡಿ, ಲಾಸ್ಟಲ್ಲಿ ಹೇಳ್ಬಿಟ್ಟು ಕ್ಲೋಸ್ ಮಾಡ್ತೀನಿ. ಒಂದೇ ಒಂದು ಲೈಫ್ ಇರೋದ್ರಿ, ಕಣ್ಣು ಮುಚ್ಚಿ ತೆಗಿಯಷ್ಟಲ್ಲಿ ಹೋಗ್ಬಿಡುತ್ತೆ. ಓದೋದು, ಓದಾದ್ಮೇಲೆ ಮದುವೆ ಆಗೋದು, ಮಕ್ಕಳಾಗೋದು, ಆಮೇಲೆ ಒಂದು ಮನೆ ಕಟ್ಟೋದು, ಸೆಟ್ಲ್ ಆಗೋದು ಎಲ್ಲರೂ ಮಾಡ್ತಾರೆ. ನೋಡಿ, ರಾಣಾ ಪ್ರತಾಪ್ ಅವರು ಕೇವಲ 56 ವರ್ಷ ಬದುಕಿದ್ರು. ಶಿವಾಜಿ ಮಹಾರಾಜ್ ಕೇವಲ 50 ವರ್ಷ. ಶಂಕರಾಚಾರ್ಯ ಅವರು 32 ವರ್ಷ ಅಷ್ಟೇ ಬದುಕಿದ್ದು. ಸ್ವಾಮಿ ವಿವೇಕಾನಂದ 39 ವರ್ಷ. ಬೇಡ, ನಾವು ಲೇಟೆಸ್ಟ್ ಓಶೋ ಶೇಕ್ ಮಾಡಿಬಿಟ್ರು ಸ್ಪಿರಿಚುವಲ್ ಫೀಲ್ಡ್ನ. 58 ವರ್ಷ ಅಷ್ಟೇ ಬದುಕಿದ್ದು. ಹೆಂಗೆ ಬದುಕ್ತೀವಿ ಅನ್ನೋದು ಇಂಪಾರ್ಟೆಂಟು. ದಯಮಾಡಿ ಹೇಳ್ತೀನಿ, ಆಯುಷನ್ನ ನೆಕ್ಸ್ಟ್ ಜನ್ರೇಷನ್ಗೆ ಪಾಸ್ ಮಾಡುವಾಗ ಅದ್ರ ಪವರ್ ತೋರಿಸಿ ನಾವು ಪಾಸ್ ಮಾಡೋಣ ಅಂತ ಹೇಳ್ತಾ, ಈ ಒಂದು ಅವಕಾಶ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ AFI ಧಾರವಾಡ ಟೀಮ್ಗೆ ಧನ್ಯವಾದಗಳು. ಮತ್ತು ಸ್ಪೆಷಲಾಗಿ ಮೋಹನ್ ಬಿರಾದರ್ ಅವರು, ಉದ್ದಾರ್ ಸರು, ಮತ್ತು ನಮ್ಮ ಕುಂಬಾರ್ ಸರ್, ಮತ್ತು ಎಂಟೈರ್ ಟೀಮ್ಗೆ, ನಮ್ಮ ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್ ಅವ್ರಿಗೆ, ಡಾಕ್ಟರ್ ಅಮಿತ್ ಅವ್ರಿಗೆ ಸ್ಪೆಷಲ್ ಧನ್ಯವಾದಗಳನ್ನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ದಯಮಾಡಿ ಇಲ್ಲಿಗೆ ನಿಲ್ಲಬಾರ್ದು. ಕೈ ಮುಗಿತೀನಿ, ಮೂಮೆಂಟು ಫೈರ್ ಹಂಗೆ ಹೋಗ್ಬೇಕು. ಮುಗಿತಾ? ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
Thank you, sir.
ತುಂಬ ಧನ್ಯವಾದಗಳು ಸರ್. ಶ್ರೀಯುತ ಹರೀಶ್ ಆರ್, ಉಪಾಧ್ಯಕ್ಷರು ಆಯುಷ್ ಟಿವಿ, ಇವರಿಗೆ ಸನ್ಮಾನ ಕಾರ್ಯಕ್ರಮವನ್ನು ನಡೆಸಿಕೊಡಬೇಕೆಂದು ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರ್ ಮಾಂಡ್ರೆ, ಡಾಕ್ಟರ್ ಅಮಿತ್, ಡಾಕ್ಟರ್ ಸುನೀಲ್ ಸಿದ್ದಾಪುರ್ ಹಾಗೂ ಡಾಕ್ಟರ್ BS ಗೌಡಪ್ಪ ಗೌಡರನ್ನ ಕೇಳಿಕೊಳ್ತೇನೆ. ಸರ್ ರವೀಂದ್ರ ವಾಯ್ ಸರ್, ಡಾಕ್ಟರ್ ರವೀಂದ್ರ ವಾಯ್ ಆ್ಯಂಡ್ ಡಾಕ್ಟರ್ ಸೋಮಶೇಖರ್ ಹುದ್ದಾರ್ ಸರ್ ಸಹ ಭಾಗವಹಿಸಬೇಕೆಂದು ಕೋರಿಕೆ. ಸರ್, ನಿಮ್ಮ ಪ್ರೋತ್ಸಾಹದ ಮಾತುಗಳು ನಮ್ಮ ಎಲ್ಲ ಯುವ ಪೀಳಿಗೆಯನ್ನು ಪ್ರೋತ್ಸಾಹಿಸಲಿ, ಆಯುಷ್ ಒಂದಾಗಿರಲಿ ಅಂತ ಹೇಳಿ ಕೇಳ್ಕೊಳ್ತೀನಿ. ಧನ್ಯವಾದಗಳು ಎಲ್ಲರಿಗೂ.
Now, last but not the least, we come to the prize distribution for paper and poster presentation. We are pleased to inform all participants that the distribution of prize and certificate for the paper presentation event conducted online on 2nd August 2025 has been completed. The presentation were expertly judged by Dr. Yashoda, Dr. Mahant Swami, Dr. Srivatsa and Dr. Chakrasali sir, whose valuable insights and fair evaluation greatly contributed A big round of applause for making this contest truly unforgettable.
Third prize women survey Abuti. Second prize Praveen Desai and Sagar Anand. First prize Sharanmala Patil Abu Prasanna. First prize is the International Direct Sharanmala Patil Abu Prasanna. Take it.
Congratulations to all the winners. Your hard work and dedication have truly shown today. Let's give them all a big round of applause for making this conference today unforgettable. Now, I invite Dr. Ramesh to deliver the presentation speech. Please welcome him with a strong round of applause.
Good evening, everybody. Respected English, comrades, esteemed guests, fellow colleagues, delegates, and friends. It is with immense pride and gratitude that I stand before you today at the failure conference on clinical approval of medical disorders in medical practice. Under the banner of Ayush Dhara, the flow of knowledge, this was not a mere debate, but a movement coming together of brilliant minds, compassionate leaders, dedicated practitioners, leading the wonderful and the quality of healthcare, and spread the healthy wisdom of the system far and wide. Eminent speakers and delegates who have started from different parts of the state to different state, your presence is not just an honor to the platform, but also a testament for your commitment towards knowledge sharing and education. And also with the acknowledge the added efforts of organizing committee, volunteers, and supporters who have all gained mind to make this event possible. Ayush Dhara for English as a continuous stream of flowing of the system that connects existing practice with modern technical challenges. Today's focus on also both timely and necessary. In an era of stress, lifestyle changes, and degenerative disorders, our ancient times have also answers like Ayurveda, yoga, this kind of therapy. This conference was just about lecture and presentation. It's about building bridges which is between theory and practice, between tradition and innovation, between senior experts and end conditions. The welcome college should today will enlighten us in development, chapter practices, skills, and God strategies. Friends, as a practitioner, we carry a sacred responsibility. Every person who asks for training comes to know. So that we listen, understand, and guide them toward belief. Let us remember that our responsibility is to ensure balance, validity, confidence, the lives and health. Before I conclude, I need to make some points like our research and role players, and to me, from here I have promised and we have myself I is whatever we can do that what I need. Thank you.
Thank you, sir.
Before we conclude, we should not forget one thing. This particular Ayush Dhara conference could not have been a successful event without the support of our company or all sponsors who are sponsors wholeheartedly for this function. So I will requesting one of us from the beginning as a leadership for individuals on the dais to give a small moment to the total number of EFI. I will request Ayush and to give a small number of Next, correct.
Sir, go sir.
ಅವ್ರಿಗೆ ಒಂದು ಸಲ ಸ್ವಲ್ಪ ಶೋಲ್ಡರ್ ಬರತ್ತೆ ಶೋಲ್ಡರ್ ಬರತ್ತೆ ರೈಟ್
Dear delegates, as we approach the conclusion of this memorable event, I would now like to call upon Dr. Ayush Dhara to deliver a vote of thanks.
ಮನೆಗೆ ಹೇಳಿ ನಮ್ಮ ಭಾರತದಲ್ಲಿ ಏರ್ಪಡಿಸಿರುವ ಆಯುಧ ಮಹಾಸಂಘವನ್ನು ಏರ್ಪಡಿಸಿದ್ವಿ. ಇದರಲ್ಲಿ ವಿಜ್ಞಾನಿಗಳ ಧನ್ಯವಾದಗಳು ಮಹಾತ್ಮಗೆ
ಈ ಕಂಪನಿಗಳಿಗೆ ನಾನು ಧನ್ಯವಾದಗಳನ್ನು ತಿಳಿಸಿ ಇವತ್ತು